The information that's going to be talked about tonight.
Sure. Notice is hereby given by the Chair of the St. Lawrence County Board of Legislators that the Chair and the members of the Board of Legislators of the County of St. Lawrence will meet at the Board of Legislators Chambers Courthouse located at 48 Court Street, Canton, New York at 5:50 p.m. on Monday, October 4th, 2021 for the purpose of conducting a public hearing regarding adopted proposed local law C for the year 2021, setting the salary for the county attorney. Be it enacted by the St. Lawrence County Board of Legislators as follows. Section 1. For the year 2021, the salary for the following titles shall be increased to the amount listed below, and the increase will be retroactive to May 3rd, 2021. County Attorney, $158,000. Section 2. Should there be a reduction in duties such as the responsibilities for the legal unit in the Department of Social Services is relocated, a review of the comprehensive compensation will occur and the salary will be returned to the prior level. Section 3, this local law shall take effect in accordance with the Municipal Home Rule Law of the State of New York by order of the Board of Legislators.
Is there anyone who wishes to comment? Hearing no comments, the public hearing is now closed.
Kevin, was there something to eat? Cookies? No, thank you.
You sure?
Yeah, I'm sure. Thank you, though. I should.
Well, you can say it's for you and then actually put it on my list.
I'd like to call to order the October 4th, 2021 St. Lawrence County Board meeting. We have a roll call vote. Kel?
Reagan,
Not a vote, but a roll call attendance.
Yep.
Here.
Forsythe,
Here.
Lightfoot,
Here.
Sheridan,
Here.
Smithers,
Here.
Denisha,
Here.
Perkins,
Here.
Akers,
Here.
Fay,
Here.
Haggard,
Here.
Fiaco,
Here.
Burke,
Here.
Arquette,
Here.
Terminelli,
Here.
Curran,
Here.
15 present.
Legislator Denisha, would you lead us in prayer, followed by the pledge of allegiance?
Bless everyone. God will get you peace. Dear Heavenly Father, this evening we thank you yet again for this opportunity to gather in your sight. May you grant us emotional, physical, and spiritual protection while helping us trust in you as our refuge and strength. We pray that you will guard our minds from harmful instruction and grant us discernment to recognize truth. We pray that you will make us strong and courageous in the presence of difficult times, as by the frailty of our nature, we cannot always stand upright. Let us remember that it is written in Job chapter 11, verse 18, and I quote, "You will be secure because there is hope." All these things we ask in the name of Jesus Christ, to whom all things are possible. Amen.
Amen.
Pledge allegiance to the flag of the United States of America, to the republic for which it stands,
One nation, under God, indivisible, with liberty and justice for all.
A motion for suspension of the rules so that we can allow the attendance of legislators who are not in attendance. Mr. Denisha makes a motion, Mr. Smithers seconds. All in favor?
Aye.
Opposed? Carried. Next, we have approval of the agenda. We're gonna need to amend the agenda to remove section 13 on this.
Mr. Chair,
Yeah,
we have a group of people who
Come on in the back.
want to come in, they're not sure where to sit. We,
How many people do we have?
and
Put them in the back. Those chairs maybe in the back? You're welcome to sit here, have a sitting here this way. And there's a couple chairs right here.
Welcome to sit up
Yeah, come
here.
down front.
One of these cats.
You guys can sit here if you'd like, yes? Yep.
feel free to send chairs in front of anyone that would like to sit down. 9 or 10 chairs here if you want to sit down.
Don't make us get them for nothing.
Okay, we need an amendment to the agenda to remove 13, section 13 of this agenda under budget presentation. And we're going to remove the budget presentation. We're going to add the executive session in its place. And Mr. Smithers makes the motion, seconded by Mr. Lightfoot. All in favor?
Aye.
Opposed? Carried. Now we need a motion on the amended agenda. Mr. Perkins makes the motion, seconded by Mr. Fay. Any discussion? All in favor?
Aye.
Opposed? Carried. Next, we will have, someone will need to make a motion to approve the minutes, September 13th minutes. We have a motion. Ms. Haggard makes the motion, second. Mr. Perkins seconds. All in favor?
Aye.
Opposed? Carried. Now we have a COVID update by Dr. Williams and Jolene Munger. Who would like to go first, Doctor?
Jolene's gonna go first.
Go ahead.
Okay. So as of today, we have 10,863 cases. There are currently 18 people hospitalized. We have 412 people active on isolation, with 10,329 that have completed isolation, and there have been 122 cumulative deaths since March of 2020. For the hospitalizations, you can see that we are starting to drop a little bit. Like I said, we have 18 for today. We have been in the last week in the high teens, which is down from the high 20s, which is good for us. For our weekly cases, so far this week, we have 344 cases with 1 day remaining in our reporting period. This is down from 400 last week. Our average new daily cases per week, we're at, with the 1 day still not in there, we're at 54 cases per day, or 57 cases per day. Last week, we were at 54 cases per day. And the 2 weeks previous, we were at 73 and 79. So we are starting to see a slight decrease in cases, but we're still higher than where we would like to be. Part of that is our school cases for K-12 schools. So for the whole month of September, we had 480 K-12 school cases, and that can be students, faculty, staff. So we were averaging 108 cases per week for the month of September. And so far for October, we have 39 cases. For our weekly college cases, we're down to 10 this week, which is down from 24 and 28. So that is on the trend that we like to see. They're just, catching a few here and there with their weekly testing. So we have the 412 on active isolation, and in quarantine, we have 1,348 people in quarantine. So a total of 47,721 people have been through the process. For our monthly cases by age group, at the last board meeting I showed August, so I wanted to show a comparison for our September to August. We had an increase of 1,167 cases this month over what we did see in August. 33% of our cases are in that 0 to 19 years age range. 35% is the 20 to 44. So the majority of our cases are under, you're seeing them to be underneath the 45 age range. And as you can see, the older the population gets, the fewer cases we are starting to see. For our hospitalizations by age group, we had an increase of 31 people hospitalized for September. And the average age range for being hospitalized is the 55 to 64 year range, with 30% being hospitalized in that age group. For our county statistics, we are still in a high transmission zone. Our positivity rate is between a 6 and a 7% still. Our total population that is fully vaccinated is 53.6%. For the current eligible population, that's 12 and older, we're at a 61.6% for fully vaccinated. For the 18 plus population, we're at 62.7%. And for 65 plus, we're at an 82.3% fully vaccinated. For our distribution, we have done 6,344 first doses and 5,624 second doses. So it should say during October. So still during October, we are still doing every Monday and Wednesday, excluding the holidays, from 8:30 to 2:30. We are now also doing Pfizer boosters, and that is by pre-registration only. If you do need transportation, you can call the Volunteer Transportation Center to arrange a ride. They do ask that you give them 48 hours notice if possible. And I just want to go over briefly what a third dose versus a booster is. So for the third dose, that is eligible for Pfizer and Moderna, and it can be received 28 days after a second dose. It's for those who are severely immunocompromised. A booster shot is for Pfizer only, and that's 6 months after your second dose. It's for certain age groups, medical conditions, high-risk employment. If you're unsure of which dose might be right for you, contact your primary care physician to see which one, if you are eligible for either. And not everybody is going to be eligible. If you do have Moderna, there is not a booster shot yet. For those, it is for Pfizer only. And then for anybody that is 65 plus, the Office of the Aging can help register for appointments again, as many sites, including ours, are pre-registration due to the need to double check the vaccine type and date to ensure eligibility. So Office of the Aging is more than happy to help out any senior that would need help, or just any type of help with navigating the technology to get registered for that dose. And one of the questions that we have been getting is flu shot and COVID vaccine. So can I receive my flu shot at the same time as the COVID vaccine? And the answer is yes. You can receive the COVID vaccine with any additional vaccine. So if you want to get your flu shot and you want to get your first dose while you're there, that's great. If you want to get your booster shot while you're there for your flu shot, that's great too. Do I still need my flu shot this year, since there was not a lot of flu last year? And the answer is yes. We are starting to see more respiratory non-COVID cases this month. So along with COVID, we do have a lot of the illnesses we did not have last year. And just a reminder as to who can get a flu shot, it's everyone 6 months and older. And what's the best time to get a flu shot? The best time is now, to get it at before or at the beginning of the flu season. And that is the end of my presentation. So I'll turn it over to Dr. Williams.
Go ahead, Doctor.
All right. Good evening. So I again wanted to start with national trends because I think they're important. So if you look at what's happening on a national level, we've seen, fortunately, in the past several weeks, a fairly substantial downturn in the number of cases. Again, this is nationally. And if you look at the trend summary, again, you see for cases a negative 28% decrease in the 14-day average for cases. You also see a decrease in hospitalizations. And for the first time in a while, there's actually a decrease in the number of deaths. So that's encouraging, again, on a national level, and a little bit of a local change that Jolene mentioned as well. If you look at where the cases are occurring nationally at the highest prevalence region, right now this is sort of shifted to the upper Midwest and away from the South and the Southeast. One of the topics I wanted to just mention was the difference between immunity that is from vaccine versus the immunity that comes from the infection. So if you look at these two different ways that people develop immunity, so natural immunity is developed if you get infected with COVID-19. The risks of this kind of immunity are that, people have a potential for severe illness or even death from infection. If people don't die, there are a number of other pretty significant associated illnesses like deep vein thrombosis, myocarditis from the infection, pneumonia, and stroke. We know that there's a possibility of long COVID. Some studies estimate as many as 2 out of 3 individuals with the infection end up with long COVID. And the outcome is unpredictable from infection. Some people get away with a nasal congestion and sinus irritation, but other people get very sick. And unlike before Delta, it's sort of unpredictable in terms of age. It's not just for people who have an advanced age who do poorly. As far as the durability of natural immunity, this is certainly an area of research. It's likely variable. It's at least 3 months. There are some studies that suggest it can last up to a year. One interesting study that was recently published actually demonstrated that about 1 out of 3 people who had the infection don't have detectable antibodies. Again, this is an area of some controversy, but something worth noting. As far as the effectiveness of the immunity that people get from the infection, it does, as you would expect, it is specific to the variant that the person was infected with. And we do know that people can become reinfected. There was an interesting study published in The Lancet where they looked at a particular area of Brazil where they had a very high background rate of natural infection and presumably immunity, yet people continued to get reinfected at a fairly high rate. So that's natural immunity. So for vaccine immunity, it's developed through vaccination, currently in this country through Pfizer, Moderna, or J&J. The risks are, there's no risk of infection from the vaccine itself. It's generally considered safe, and as we know, people have some mild, brief side effects. There are some extremely rare, significant side effects. As far as durability, it again is variable, depends, if somebody's immunosuppressed or if there's some other factors, but it appears to be of at least 6 months duration, and it's also fairly predictable. As Jolene mentioned, as I'll talk about more, boosters are available, so if the durability wanes, there's an opportunity for a booster. And then as far as effectiveness, what we do know is that it provides a high degree of protection from severe illness, hospitalization, and death. We also do know that there's a moderate rate of breakthrough cases, especially associated with the Delta variant. A study did come out that showed that previously infected individuals, so people who had verified COVID infection, were 2.3 times less likely to become reinfected if they received a vaccination. And so I'm going to talk about that here. So really the bottom line is that both infection and vaccination certainly provide a degree of immunity. The vaccine-based immunity is safer to attain. The vaccine-based immunity is also more predictable, and waning vaccine-based immunity can be boosted. Certainly natural immunity could be boosted through infection, but I would not recommend it. Some people have used this term that vaccine or that natural immunity is exponentially better than vaccine immunity. That's not really supported in the literature, and there's one particular study that people cite which has multiple flaws. And then finally, what we do know and what's important in practice is that vaccine-based immunity can augment natural immunity. And that's the rationale for infection of people who've previously, that's the rationale for vaccination of people who've previously been infected. I did want to mention the issue of breakthrough cases. So New York State is now reporting breakthrough data, looking at infections at both cases, but also hospitalizations. And on this graph, it shows the new daily cases in New York State, and it divides them by people who are unvaccinated, which is the blue line, and it's somewhere about 75% of the cases, and people who are vaccinated. The data is incomplete, but it gives you a pretty good picture of things. Again, this is statewide data. It goes up through the first week of September. A similar graph shows hospitalizations in New York State, and it continues to show this trend of unvaccinated people being far more likely to be hospitalized compared to vaccinated people. I do think it's important for people to realize that breakthrough cases are absolutely real. Both state and national data suggest that it's still a low percentage of people who are infected. Typically, people with a breakthrough case have a mild case, but in rare instances, it can lead to hospitalization and also death. People who have a breakthrough case are contagious, and they are still mandated by public health to be fully isolated, just as somebody who is unvaccinated. The Delta variant seems to be a key driver of these breakthrough cases. The data is not entirely clear about whether you can get long COVID related to a breakthrough case. There's certainly some indications that you can. We do think that boosters will likely decrease the risk of breakthrough cases. And then finally, just because there are breakthrough cases don't mean that vaccines aren't a critical tool. It just means that a multi-layered approach is still important. So vaccines are an important part of the solution, but they're not the only answer. So in terms of new therapies, there's some very exciting news. Merck Pharmaceuticals publicized that they have an antiviral medication called molnupiravir. Hopefully they'll come up with a catchier brand name. There was a study that looked at just under 800 adults who had mild to moderate COVID. They took people who were at high risk of a bad outcome, and they gave them this medication. It's 8 pills per day for 5 days. And what they showed is that people who received the medication, 7.3% were either hospitalized or died at the end of 30 days compared to 14.1% of the people who received the placebo. After that initial 30-day period, there were no deaths among the people who received the drug, whereas 8 people died in the placebo group. So this was considered to be a very positive finding. As with other medications, they did show, however, that there's no improvement in individuals who are already hospitalized due to severe disease. So this is a medication that needs to be prescribed or needs to be taken early in the course of illness. And finally, it's not a replacement for vaccination, but it's the potential. It has the potential, and it's a non-IV, so it's a pill, which is helpful option for treatment. Keep in mind that even though Merck announced this, it's not approved by the FDA. It's under review for approval, and it will also probably just get an EUA when it's after it's reviewed. So booster shots. So as Jolene emphasized, right now booster shots are just for Pfizer, and the FDA, CDC, and now New York State Department of Health basically put out this guidance of who should receive boosters, and they actually use 2 different categories: the people who should receive a booster and people who may receive the booster. And the idea is that the people who should receive the booster have the strongest indication for it. And those would be New Yorkers 65 or older and residents in long-term care settings, regardless of age. They should receive a booster as long as it's 6 months after their second dose of Pfizer. The second group that should receive a booster are the New Yorkers 50 to 64 who have an underlying medical condition. As far as the may receive the booster, that's 18 to 49 who have underlying medical conditions, and also New Yorkers who are 18 to 64 who are at increased risk because of exposure at work. So that would include like healthcare providers. So again, the booster has to be from the same vaccine as the primary series. And right now that's only Pfizer. Moderna has submitted their data to see if they're going to be approved for a booster. I think we're going to hear about that in the next week or two. And Johnson & Johnson is also doing research on it and will be submitting data for approval for a booster. But for right now, boosters are only for Pfizer. As Jolene covered, it's a little confusing. Moderna can be given to people who fit into one of the 6 categories of immunosuppression that was announced earlier in September. And I would emphasize that if you have a question, certainly reach out to your primary care provider. As far as where to get the boosters, the pharmacies continue to be the main place that people can get vaccinations, and that's a good place to start. But we're really working in the medical community to make these boosters available in doctors' offices. And then public health continues to provide clinics for boosters. I did want to just briefly touch on this issue of vaccine disinformation or misinformation. So just to be clear, there's a fairly strong medical and scientific consensus that vaccination is a safe and effective tool in the battle against COVID. Pretty much every US professional medical society has endorsed vaccination publicly. However, there was a study from the Center for Countering Digital Hate where they basically looked at where all this disinformation is coming from. And what they found is that about 65% of the disinformation that's found on social media is actually only coming from 12 people. So social media is able to sort of amplify this disinformation and kind of give it the appearance that it's coming from all over, but it's really just coming from these 12 people. Here's the list of the 12 people. A couple of them are physicians, most of them are not. And it's just very important to be aware of that. The other thing I'll mention is an excellent website called COVID-19 Data Science that's run by someone named Dr. Morris. And he really goes through and spends a lot of time sort of countering some of this misinformation. As an interesting point, most professional societies have now basically said that if you're board certified, like in internal medicine or family medicine or pediatrics, if you promote this disinformation, you're likely to have your board certification revoked. Some states are actually revoking licenses for people, and these are not for people who are debating the issue, but for people who are providing disinformation. And another thing I want to talk about briefly is that a common tactic is to use something called the VAERS data report. I'm going to talk more about this, and to misrepresent the significance of that information. And then finally, I would just encourage people, if you read something on social media and you're not sure if it's true, you should talk to your medical doctor, talk to a trusted health professional, make sure you're reviewing information from reliable sources, and be skeptical. If you're hearing something that's in conflict with what other people are talking about, be a skeptic, dive deeper. So as far as vaccine safety monitoring, there are actually multiple overlapping systems. There's something called vSafe, which you are invited to join once you get vaccinated. There's also this thing called VAERS, which is a vaccine adverse events reporting system. There's something called VSD, which is the Vaccine Safety Data Link. And there's something called CISA, which is a consult mostly for providers who have a question about vaccine safety. There's about 7 other systems that overlap all this. A lot of research is done through the VA to make sure things are safe. The thing about VAERS, and you'll see this in some local letters to the editor, but you'll also see this in Facebook and other places, VAERS is a system that's very important, but it has major, major limitations. One is that anybody can report to VAERS. So individual can report to VAERS, a provider can report to VAERS, but you don't have to be anyone special to report. The data tends to be very inconsistent, and it's unverified when it's submitted. One thing that you see is that if somebody dies, multiple people report that same death, yet it gets counted over and over again. Probably the most important thing is that there's no comparison group. So for instance, before there was COVID and before there were vaccines, nearly 2,000 Americans have a stroke every day, which is highly unfortunate. And so if you then introduce COVID and you introduce COVID vaccines, you're still going to have about 2,000 people dying every day of a stroke. Some of those people may incidentally have received a vaccine. And so this VAERS data system just simply reports events that occur after vaccination, but they're specifically not designed to assess causality. And you'll see in many of the misinformation, they'll say this report is attributed to a particular vaccine. That is absolutely in conflict with what that system is designed for. However, the Vaccine Safety Data Link is an example of a system where there's a comparator and there's an opportunity to look at all these potential significant problems. And what that system does is it then looks at people who received the vaccine, and it looks at people who did not receive the vaccine during that same period of time. And then it looks to see whether there is increased number of events in the people who are vaccinated. And this is a table that was published in JAMA earlier this month, and again, or in September, and it again shows that all these significant things are not occurring because of vaccination. So this is probably the single best way to check for vaccine safety. And again, if somebody starts quoting VAERS, they're quoting it usually in complete conflict with what that system was designed for. Just to switch gears with testing, to remind people, there are 3 types of COVID tests. There's antigen tests, molecular or NAAT tests, and PCR tests. The least sensitive, or the sort of essentially the least accurate, are the antigen tests, and the most sensitive or most accurate are the PCR tests. People can test at home. So there are now home test kits. Most of them are antigen kits. People can buy them in pharmacies. They can order them from online. The most important thing about those antigen kits is a negative test does not mean you don't have COVID. A positive test does mean you have COVID. If you have a positive test at home, you really are obligated to contact public health, so public health can take care of the public health component of things. So pharmacies also offer testing, and then community testing centers. And then finally, there's urgent care and emergency rooms. We strongly discourage people from going to urgent cares or the emergency room just for testing. We have worked really hard throughout the medical community to provide these community testing centers. So St. Lawrence Health System has a number of them, Claxton has them, our community health center in Canton does, and Clifton Fine have testing sites. The information is available online. There's some issues with access. There's some issues with the turnaround time. We're all working on this, but I would really ask people to use those community testing sites as their primary place for testing. So just to summarize, the national trends really suggest room for optimism. There is still high prevalence in our community. It does seem to be decreasing. It's all because of Delta. We know that vaccination continues to reduce the risk of severe illness and hospitalization. Vaccination is the safest way and the most predictable way to develop immunity. However, natural immunity absolutely provides some degree of immunity. It's just not the safe way to get there. Booster shots of Pfizer are now recommended for these defined groups that we talked about. And new therapies may be approved shortly. They're really important additions as we look to battle against COVID, but they're not a replacement for vaccination. And then disinformation, it's an ongoing problem. And I just want to emphasize that there does continue to be a strong consensus in the medical community about the importance of vaccination. We are working on testing. We know it's a priority. And then vaccination and the 5 pillars are the critical tools that we have to deal with this pandemic. And that's my presentation.
Ms. Haggard.
Thank you, Mr. Chairman. Dr. Williams, you addressed what I was going to ask you about, but I've had people ask me, when school started up, there was a surge of testing needed, and the wait times were really high to get results back. Is that better now? How are we improving on that?
So I think it's better than it was a few weeks ago. There are still challenges. We do have, St. Lawrence Health has a 24-hour PCR test. Claxton Hepburn works with LabCorp and are able to turn PCR tests around fairly quickly as well. The limiting factor, I think, has been scheduling to get the test collected. And we've really worked hard to make that better. I'm hoping people find that in the weeks to come that they are able to make an appointment, within 24 hours of onset of symptoms.
Thank you.
Ms. Terminelli.
Thank you, and thank you, Jolene and Dr. Williams both. I'm very pleased that in St. Lawrence County we have such open access to vaccination. It seems like you could really go anywhere, any day, anytime, and be able to have access to the vaccine of your choice. But I also am very concerned about the testing right now. I just happened to go on and look. And if you have a car and you could get around the county, it doesn't seem to be a problem. But if you're like in the Potsdam area, for example, the next open appointment is on October 8th, so Friday at 1:50. And in Messina tomorrow at 1:15 in the afternoon. And I know I've spoken to many Messina constituents that are very frustrated with the lack of hours. I think that the testing site in Messina closes at 2:30. They don't take appointments after. So there is limited testing, and I know that we have access to them at the pharmacies as well. I had to bring my little guy there, and I had to do his nose swab, and they told me it'd be 1 to 3 days. But then she said, "But that's not really right. It's actually closer to 5," and it was 5 days that we kept him inside to wait for a negative result just because he had a little fever, and I just wanted to make sure that we didn't put anybody else at risk. So many people have reached out with their frustration with the access to testing, but then also the delay in hearing back after the testing. And so I know it's a very convoluted, messy situation. So can you just kind of explain, just so everybody understands, from the point of testing, what does it look like? So you go, you get your test done, and then how does that work after that? How long before we get test results? Who gets the test results? Who does it get reported back to? How does contact tracing work? If you could just maybe go over that, just so maybe the public has a better understanding of it.
So I think that one of the challenges is there's different testing sites, right? So if you get tested at St. Lawrence Health, the process is a little different than if you get tested through Claxton. It's a little bit different if you get tested through the Community Health Center. I'll just speak with St. Lawrence Health and the Community Health Center, which I'm directly involved with. So if you sign up at the testing center, you get the swab collected. The test is not run at those collection sites, but it's transported by a courier to the lab. The lab where we run it, and this is for Messina, Governor, and Canton Potsdam. Some of them have PCR devices in the hospitals themselves. Some of them transport them to Potsdam. But it's a 24-hour PCR, either on the Rionic machines or on something called the Panther. At my request, we call every single person with their test results. And then we communicate any positives to public health. If it's collected at the Community Health Center in Canton, we actually courier it over to Canton Potsdam Hospital, which does the same process. It's just coming from my Community Health Center. And we also do some point of care testing with the Abbott ID Now when we have that available. For Claxton, they are using LabCorp, which is a reference lab. So they also collect the samples, and the majority of their samples are going to be sent to LabCorp. At least as of the other day. They also have Rionics, and I think they're trying to do more in-house with the Rionics so that they have a turnaround time that's a little bit faster. When you use a reference lab, you're dependent on those reference labs for the turnaround time. And what happens nationally is when there's a big surge, places like LabCorp, they were getting tons of specimens from Georgia or what have you, and so their turnaround time slowed down. But Claxton's pretty consistently feel like they get kind of I think they say 24 to 48 hours from LabCorp. And those are the primary, that's the bulk of where the testing is being done in the community. Again, I think and the pharmacies, I should say, they do collections. When I've spoken with the pharmacies, they do tell me that they're usually kind of a 3 to 5 day turnaround time for the pharmacies for the ones that they collect and they send out. Now, the pharmacies at times do have the antigen cards, which you can take home and get a result in a shorter period of time, but you're compromising the accuracy of the test. I don't know if that's helpful.
It did very much. So it sounds like we're getting results back on tests within no more than 48 hours, right?
That's what's supposed to happen. Now, I'm sure people have heard of exceptions, and I've always invited people to reach out to me directly and to Jolene to the times when things don't work out or help, inform us on how to fix the process. But there's a recognition. We meet 2 or 3 times a week to talk about this, and a lot of it has to do with staffing, like having more people to do the collection. The emergency order that the governor issued does allow a broader range of people to do the collection for the nasopharyngeal swab. So things like that might actually help.
And then Jolene, once you get contacted at public health, how does that process? I know some of the contact tracing isn't being done in county, right? It goes out. And so we don't have control over that. And then some is done from within the county. So how's our staffing and how's our caseload? Because I've heard people saying it's been, 5 days since they were contacted. I recently came across some people that said they self-quarantined because they were never contacted, but they weren't put on the list. They went to public health. It wasn't public health's fault. It was the reporting person that was positive. So how does that work once it gets to you? And what's the turnaround and what can we do to make it quicker?
So for a while, our turnaround was about 5 days for cases because we jumped from having 2 cases per day up to almost 80 cases per day very, very quickly. And so for our staff, we also have our regular full-time non-COVID jobs. And then COVID is a full-time job on top of that. So we do work with the state team for that. I was able to get additional state help to help get us caught up. So we have state contact tracers, we have contract RNs, plus my staff that do the case investigations. We are dependent upon the cases to be honest with us, which is not always the case. So they might tell somebody that they were a contact, but they don't name them. So when somebody, in that case, somebody might never get a call that they're expecting you to get a call because we might not just know who they are. Once the contacts will get put into the system, it could be a little bit of a delay because of how long it might take for the test to come back. So say somebody started with symptoms on October 1st, they wait to get tested until today. And then, if their test results don't come back until even say tomorrow, we go 48 hours prior to the symptom start date or the test date. So we would go back then to the 29th of September, but we don't actually find out until October 5th. So there is that delay depending on when somebody chooses to go get tested. Not everybody, makes that choice to get tested the same day that their symptoms start. So all of that does put a delay in that. There is nothing that we can really do at public health just because of the timing of it all. So when contacts get put in, as I showed, we have just over 1,300 people in quarantine right now. So that's actively in quarantine. So with that, we have the state contact tracers that do most of our calls. They try everybody 3 times. So if you get a phone call from a 518 number, that's the state contact tracing team. They'll call 3 times in a row, leave a message. They don't have a way for you to call them back. So as people call our office, if they miss those calls, we're taking them. We did just recently hire a new staff member to help with those calls, along with the contract RNs that we have from the state. So we are with the contacts now down to a 48-hour turnaround time with that. But that is all based off from when we get the contacts from the cases, and that's based off from when they decide to get tested. Does that help answer your question?
Yes, very much. There's many, many, many parts that make the time frame a little bit longer. It's not that any specific entity is to blame. Is your staffing good? Do you need more staff to get the contact tracing done faster? Or do you feel that your team's able to manage it right now?
So that is something that we are constantly reevaluating where we are at with what we can pull in. And some of it it fluctuates depending on the day with how many new cases come in and where we're at with our other cases, our other case loads. So for early intervention, it depends on, how many new referrals come in on what staff can do for COVID that day versus their regular casework. Same thing with communicable diseases. Rabies, anytime somebody reports a dog bite or, they see a rat or somebody decides to pick up a raccoon because they look pretty or something. So it just depends on the day where we're at, but I'm actively working on recruiting more. We are getting a 3rd school specialist to start helping with the schools to get school contacts entered in a little bit more. We just hired last month a a staff member to help manage our school's testing program, which we started last week for all of the unvaccinated faculty staff. So that program is going smoothly. So it's something that I'm constantly reevaluating to see where we're at. And we're working with the state on another program to get fellows into our office. So that will increase our staffing once that program gets up and running.
Thank you very much. Thank you for your efforts.
Any more questions? I don't see any. Thank you, Dr. Williams. Thank you, Jolene.
Thanks.
Thank you.
Next on the agenda is communications. Kelly, do you have any communications?
I do. A resolution was received from Oswego County Legislature submitting comments to the National Oceanic and Atmospheric Administration regarding its draft management plan and draft environmental impact study for the proposed Lake Ontario National Marine Sanctuary. A card was received from the family of Sergeant Ryan P. Shelley, thanking the Board of Legislators for their generous support and encouraging words. And I do have one letter that I'll read for citizen participation. It's from Cedric Somerville from Seattle. My name is Cedric Somerville, and I'm writing this because my daughter, Triana Somerville, was found dead in the home of her mother in St. Lawrence County. I am writing this because DSS and CPS failed my daughter. The system failed to get my daughters out of a house where it was crystal clear that she was being abused. The part that is disturbing to me is that CPS visited the house numerous times and nothing was done. The St. Lawrence County CPS has failed my daughter and so many other children with no explanation on why this is happening over and over, even after my daughter's death. I want answers and something needs to be done, and this broken system needs to be held accountable. I demand answers.
Next, we have citizen participation. Any citizen that would like to talk, please come up to the podium. You'll have like 5 minutes. And state your name as you stand at the podium. And William Roan. Mr. Roan, before you get started, can I give you some advice?
Yes, sir.
If there's any things that will be said by you that will be attacking the personality of any individual, like using their name, allegation or something that will be harmful to that person, perhaps just steer away from that if you wouldn't mind. And the public officials, we're all open game. You can say anything you want to say about us public people, but it's private citizens that I'm trying to protect.
Very good.
Okay?
I understand that. Hello, hard to believe another meeting. Another month and another dead starved child. It's nice to see you all again. The preliminary report, we read it. Mr. Skelly is not alone in wanting answers. Mr. Lightfoot, you had a foolish response, and Mr. Akers, you were not worthy of responding. Gentlemen, do we want more money spent on this problem? No, we want you to be lawmakers and bring this to light. Use your subpoena power. Here's a foolish response. We, the people, can no longer trust the oversight of this legislative body concerning DSS and CPS. The people request a public hearing before this committee. It's time for people like Ackerman, Haggard, Burke, French, etc., to be made to testify publicly. The 175 plus children and family victims deserve a voice and answers. The report says 3 times the placements. As a teacher, I sat at a lunch table with Principals Joe Ruddy and Matt Daly when they discussed who they would and would not send CPS after. Some incidents which I reported, cutting and bruising, occurred in the wrong families for those children. Ruddy and Daly chose not to handle all those things in-house. Other families, especially those of single parents, were subject to multiple CPS inquiries. Sound familiar? I know Mr. Ruddy was successful in emancipating a child from their family. I also know all these children somehow disappeared.
In St. Lawrence County, nepotism appoints school administrators. Mr. Burke, you have 2 sons who are superintendents in St. Lawrence County. This past week, 3 sexual assault complaints were filed with SED against Mr. Lemire. Mr. Burke was contacted by concerned parents, and even an assemblyman reached out on our behalf. Mr. Lemire was filmed walking into the building Friday working as a sub. Mr. Burke claims in the paper that I am conducting a smear campaign. Personally, intellectually, and morally, I don't feel Mr. Burke should be a superintendent. I feel alcohol is a big problem in our county. John and Eric Burke should not publish Facebook pictures of each drinking and drunk in front of students on John Burke's public Facebook page. Eric Burke's foolishness, Mr. Lightfoot, is his malicious attacks and defamation of my character. Mr. Lightfoot, a foolish man, is a stupid man. However, unlike him, who can put anything out there, I need proof. Case in point, February 9th. I tried at a school board meeting to talk about sex trafficking. Instead, I was arrested for stalking Tina Bush, Lisbon school principal and Madawatington school board president. She was at work 2:25 when she received a text message from her mentally unstable neighbor. It said I drove by her house in a black car, which I don't own, from the opposite direction of where I live. I was arrested, issued a restraining order, and currently await a trial because of a text message sent to Tina Bush at her work by a crazy neighbor. Yet we need proof. Tina Bush, in her accusatory statement, states she solicited her husband, Brian Bush, to protect her during the 2-9 meeting. He chose to harass me in the parking lot, and he threatened 7 people who came with me. A 911 call was made to the sheriff. The sheriff did not respond. He refused to take our statements. The undersheriff O'Brien called up Kim Costanza, a friend of mine who recently died of a heart attack, and he said, "You need proof." He screamed at her. Well, Triana Somerville is proof that administrations and police are the root of the CPS problem. A senior for 4 years in Governor School, Principal Corey Wood, School Resource Officer Robert Kilowitz were provided with emails, messages, and tangible proof of the abuse. District Superintendent Lauren French was told very specific information about the abuse. She told concerned parents they had the right to call CPS and police enforcement. Sleeping in a laundromat 3 weeks prior to her death, cuts on her face and a bloody shirt. Police officer Jason Whitten responded, said it was self-inflicted. She had bruises and cuts on her face and body. She came to school with chunks of hair and a tooth missing. On hot days, she wore hats and hoods up and arms covered to hide the bruises on her arms. We need to take power back from these local administrators and law enforcement. We need a centralized school administration. We need to fix the police department. We need to make CPS truly protective. It's time for transparency. Oh, and Ms. Haggard, nice to see you.
Mary Skelly.
Wow. Anybody teared up? My name's Mary Skelly, inmate Skelly. I was put in prison June 23rd, 2020 by Judge Cecilia Morris. I'm a child trafficking victim. My daughter and I were put in prison. She escaped captivity in Florida. She struggled mentally, physically, and emotionally to understand what was even happening to her. Me too. But we're in prison. Inmate Skelly is here tonight. September 23rd, another one. Parole board, another one. Another abuse, another open abuse. She was punched in the face. Denied bathroom. Denied access to a bathroom. Urinating on herself. So during my sentence, I've tried, writ habeas corpus, I've been denied, clerics. They even put on the writ habeas corpus, Steve Button, the county attorney. No, it's the Office of Children and Family Services. You get their attorney, the state attorney. I'm in state prison, I'm in state custody. Steve Button's not gonna be able to help me. I don't know how many of these. I've applied for attorney. We don't have an open file. I paid $305 to get an open file on a writ habeas corpus, an emergency production of my daughter to Judge Seeley's court on the abuse. How much more should I take in prison? Limited access, but guess what I do have a good understanding of? They don't like me to go to the law library much. They don't. I don't get much time at the law library. They don't want me, reading and researching. But I do have an above average understanding of this Constitution, the United States Constitution right here, above average. So I am so appreciative of the people who get me the Wall Street Journal. I get the Wall Street Journal, inmate Skelly. Facebook tried to make platform healthier, got angrier instead. Facebook knows Instagram is toxic for teen girls, its research shows. Facebook staff flags trafficker cartels, company response is weak. A little more of the same here, right? Weak. Facebook documents reveal secret elite exempt from its rules. Let me tell you what happened to inmate Skelly this week. She went over to, last Friday, October 1st. I went over to family court to put in a petition because Judge Morris ordered my daughter and I to prison. But Judge Morris also said that we could have video calls every Saturday and Sunday. Doesn't happen, folks. Does that shock any of you? I mean, she's abused, what? Every other week? Has anybody called on her behalf? Anybody called on my daughter's behalf? You're all witnesses. You're all witnesses to get this girl out of hell. No. So I go through, I have my personal property on me. I have a cell phone. I am identified immediately as Mary Skelly. I've gone through the metal detector. My phone is a small plastic bucket. And the officer told me, I'm holding on to your phone. 14th Amendment, illegal search and seizure of my phone. Mary Skelly can't go into a Judge Morris's courtroom with a phone. So at this time, a group of court officers ambushed me. I am removed myself back from the petition, begged for my phone back, and I start recording. Because guess what? Let me tell you about the Constitution of this land. First Amendment. I'll refer you to the 11th Circuit Court, Smith versus Cummings. Completely legal to film, police, public employees in the course of their duties based on 3 factors: time, place, and location. Why am I being targeted? Why is raising child trafficking awareness and such a desperate attempt to protect the safety and well-being of our children a crime? I'm going to be put in prison for this? Really? The officer over there needs to be put on administrative leave. It's a crime what he did to me. He illegally took my property. They've illegally got my child's.
Time is up.
Thank you. And they won't assign the attorney.
Francine Griffin.
I would like to address the Bonadillo group that is on this board's agenda with a proposition to hire in regards to CPS investigation. This group is an accounting, business advisory, payroll, and personal financial service. How will a CPA group help anyone other than DSS and county employees? If they help a family DSS system, that's wonderful. But as for the 175 complainants and victims, I don't believe they will address the issue or seek accountability. Your agenda tonight seems to be geared towards saving face in the public, and there is absolutely no mention of addressing wrongdoing committed against the victims. Speaking for myself, I don't need a CPA. This board has denied wrongdoing for months until Office of Children and Family Services documentation surfaced, revealing wrongdoing. Mr. Sheridan gave a one-liner in 7 News that we're going to do better all across the board. My question is, when are you going to address the wrongdoing and seek accountability? There seems to be an attempt to sweep this under the rug. CPS is not completely to blame. Yes, they're driving the bus, but there are many passengers. It's a systematic failure in this county. How does a CPA group have the legal ability to address and implement accountability for wrongdoing committed against the complainants? Can this group deal with the systematic failures? Some examples are perjury and support perjury, to name one of many in family court. A crime that is considered an everyday occurrence, it's never addressed. It allows the abusers to continue the abuse, harass the victims using the very system that was intended to protect the innocent. Will they address selective authority of the law and cover-ups within the DA's office and law enforcement that have done so over the safety and well-being of children? Why are the laws that are put in place to protect the innocent not being enforced in this county? There's absolutely no accountability. Many complainants have been from one end of this county to the other seeking help. Many just having backs turned on them. With the increased cases and the victims of wrongdoing and the decisions, and it has caused a great deal of trauma. I won't bother to recap the grievances and complaints against CPS. It's been addressed here frequently. I believe that what will be discussed on the agenda tonight is an attempt to save face in the public eye, but you've done nothing to correct the errors, the injustice, or wrongdoing by CPS. Their victims are still living in what I like to refer to as the twilight zone. When do the victims get justice? Many complainants are dealing with children with mental health issues because of the trauma that's been inflicted. Older children acting out in sometimes violent and unacceptable ways. Younger children are afraid to say a word, revealing the trauma with crayons and markers. Many children lying in their beds at night, praying and hoping help will come for them. Help hasn't come for many. Some children have paid for their lives. Some within CPS has failed to hear children, and they dismiss what counselors, mandated reporters, and others have said. Complainants have been coming here for months, wanting answers and accountability, only to have been met with no wrongdoing and silence. I have contacted the New York State Joint Commission on Public Ethics and asked for an investigation into the possible conspiracy of cover-up wrongdoing within this case. In case you haven't quite got the message, we aren't going away. We will not allow you to sweep the wrongdoing under the rug. The number of CPS victims increases every month that goes by. The stigma associated with CPS that will be mentioned here tonight is the stigma that CPS has earned. Thank you.
Mr. Snyder.
Patricia Snyder, this is Carol Lee Stearns. We both work in CPS. Tonight, I would like to read a narrative that was written by Jamie Stone. She's a CPS supervisor in the state of Illinois. I am CPS. I am the worker for children who are being hurt and neglected every day. I am the worker knocking on doors of strangers all hours of the day and night. I am the worker standing in front of an angry parent, listening to them hurl insults and threats at me for doing my job. I am the worker walking into homes of people who are high, drunk, mentally ill, and violent. I have nothing but a pen and paper to protect me. I am the worker holding your child after your boyfriend raped her. I'm the worker taking photos of the child you broke because he wet the bed. I'm the worker keeping a calm face while your child describes the horrible things you have allowed to happen to them. I am the one at the emergency room waiting to see if your baby will survive having been shaken. I am the voice to remind them they will be safe now. I am the one calling relatives, foster parents, anyone I can find to take in your 5 children because you chose your boyfriend over them. I am the one sleeping in an office with your children because there aren't any homes available. I am the one begging and pleading at 2 a.m. for a placement. I am the one digging through my own children's belongings just so your children can have socks and shoes. I am the worker you demonize all over social media. I am the worker society has said should be fired, prosecuted, killed. I am the one losing sleep because I can't prove what I know in my gut is happening. But I have never hurt a child. I have never neglected a child. I have tried my best every day to keep children safe. I have begged and pleaded with attorneys, judges, parents, and children to protect these tiny people. I have to follow rules and regulations with which I don't always agree. I'm bound by federal law to help parents keep their children. I can't remove a child because the house is dirty. I have to allow the parent time to clean it. I can't remove a child because of one incident involving drugs. I have to let people go to rehab. I have to offer services before I can take children. I have to. I didn't say I want to. Hell, I'm not even saying I should, but the law says I have to. I have to educate parents about corporal punishment. I have to let parents try and fix things. I can't take away children if the judge won't support it. I can't make a judge agree with my feelings. I can only present facts. I can't make a parent tell the truth. I can't make up evidence that isn't there. I can't protect children I don't know. I can't investigate people just because. I have no say in what folder I am handed or what someone has said about you. I do my job though, and I try to be as nice and professional as I can. I try to make you feel less embarrassed, less angry, and understand that I don't think you're a bad person. I understand there are true accidents. I understand kids fall and get hurt sometimes. And I understand that there are horrible people that hurt kids. There are people that murder them. There are people that rape and torture children and go on about their day like nothing ever happened. I know there are teachers who are abusive to their own children. The clergy members who rape children, the parents who go to work all day and cook meth all night. I know the horrors you pretend will never happen to you and your family, and I know they can. And I know people can be evil at home and perfect everywhere else. They can be a wolf hiding in sheep's clothing. I don't know which is which all the time. I can't just look at a person and know that. No one admits to being a wolf. But you know what? You aren't helping. You are the voices these children hear. You are saying we are not to be trusted. You are teaching your children to lie to protect you. You are telling your children we will take them away forever. Not me, you. I can't always protect children from you. I can't overcome the power of the media, society, and parents when they tell their children to lie. I can sometimes tell a parent is lying, but I can't tell what they are hiding. I can't, even after all these years, predict which parent will kill their children. I just can't. Can you? Can you look at a person and see the evil they do, everything they can to hide? Can you tell the difference between a parent who is struggling and a parent who isn't fit? Can you predict the behavior of people you met 15 minutes before? I can't, and neither can you. No one can, but you can act. You can call and report. You want to see changes in child welfare? Then be the change. Tell your children we're safe people to trust. Remind your kids no one should ever hurt them. You can tell them that these workers who are losing sleep, losing tired sleep at a job that the world presents are there for them and will do their best. You can show support because we're all hurting.
And
But you don't have a job.
Anyone else want to address the board? You state your name, go in. 5 minutes.
Good evening, Rachel Raven from Stubborn Orange. I'm here again as the squeaky wheel to continue to advocate for our children. How sad that letter from Trayana Somerville's parents, from her father, as she grieves his death, her death, excuse me. I, on the other hand, am lucky to stand here today and let the board know that for the last 3 weeks, I have seen my kids for 4 to 6 hours a week, supervised. 3 years later, October 15th has been 3 years since our family separation. My children have yet to sleep in my house. But at least I have my children about 4 to 5 hours a week. And while I sincerely appreciate the letter that you read, and I believe there are good caseworkers within every organization and potentially CPS in St. Lawrence County, I am here to say and remind there is corruption. I have criminal charges I have presented, I will continue to present. I will echo that I have tangible evidence. Audio, I have plenty of evidence if anyone will sit down with me. If not, unfortunately, it'll be in a courtroom, likely in 2 to 3 to 4 to 5 flipping years, I'm told. But until then, I'm here to remind you that if you have a caseworker with an honest heart and a motivation to help a child, great. But then for some reason, we have in St. Lawrence County CPS workers with other motives. That motive remains unclear. Financial is definitely in the pool of reasons why. I unfortunately turned in on a felony charge the spouse of somebody high up in our CPS. And within 10 business days, I was arrested and had my children taken away. And although I routinely practice as a nurse practitioner, I can prescribe narcotics to an elderly person, I can see an infant and provide them unrestricted care in 3 states. I am denied the right to have unsupervised visitation with my 2 beautiful children. I could go through an array of concerns that I noted from the state report, concerns that I have seen, again, have tangible evidence for proof if anyone cared. But this is now my 4th, 5th month. Nobody's contacted me, and I don't know if anyone really cares. But what I can say is there's a problem, and I don't think anybody in this room can deny it. 10-year-old that passed in Messina this last week. And I want to personally thank the child organization for bringing that to light. The tireless efforts that found that name on the registry of New York fatalities under the children, under the website. And that marked a concern for us. And we have autopsies, coroners, medical professionals, law enforcement that say the cause of death. I don't need to say this, everybody knows this, it's been in the media. But CPS report says no signs of abuse or neglect. That's odd, because the same thing happened in my case. Because I had a medical doctor, 3 medical doctors say there was no reason why I shouldn't be getting routine access to my children. But interestingly enough, CPS over 15 months continued to say, mental health concerns, these concerns. Well, my kids aren't in counseling, I'm calling begging for them to get in counseling if there's mental health concerns. I'm almost to the 3-year marker and I have yet to see that. 15, 16 months into it, I'm petitioned that due to my mental health, my ACD to drop my neglect charges is being put on hold. Well, like that and the other 6 or 7 charges that were brought, they were all dropped the day of the court hearing. But they were strategically used, and I'd love to share more, but unfortunately my 5 minutes is out and I'll be back next month.
Sign the sheet before you leave.
Yes, sir.
Leave it there. Thank you. Anyone else? Yes, go ahead. You can sign this, you better state your name.
I think sign the sheet out there, but I'll sign this one as well.
I'll
I'll
go
give
get
the other sheet.
Okay.
Sign the historian, baby.
I probably did.
Yeah.
Right?
Good.
I signed the historian sheet too.
Do you know this? She heard about it.
My name is Mindy Woodruff. I was here at the previous meeting before. I'm not gonna lie, to hear your statement was unbelievable.
Yeah.
Shaking my head. They have the audacity to read that. Yes, is there a few people that are decent with CPS? That's agreeable, just as you had stated before. But that's far few in between. Most of those people don't last long. They don't last 10, 11, 20 years because morally and ethically, they can't. They're not willing to sell their soul to the devil. And the others that are still there. My number one concern is for the well-being of the children, for they do not have a voice. We are not here by a lynching mob. We are simply here asking for the help of the children. If you have once ignored the request or simply did not know, we are asking that you hear us now and make changes, not just for the future, but correct the mistakes in the past. Many children are presently in harmful and unloving environments with continued abuse and maltreatment. These changes are running on borrowed time, and unfortunately, some children no longer have that time. They passed away, as obviously you know the recent case. 22 different cases since 2010, and nothing was done, yet a current investigation was going on while it happened. What do you have to say about that? That number alone. It's insane. There are many problem areas that make up the crumbling structures of social services when decision-making is concerned. In many of these cases, there are many puzzle pieces that can be implemented together to connect the dots for any logical person that understands. Yet, the supposed trained professionals, such as an organization of social services, on every level cannot solve or understand. All it takes is a little effort, and actually a little digging. Not too hard, just doing your job, basic. It seems that CPS workers are allowed to go above and beyond their qualification to create an assessment with no real facts to back it, with no repercussions, but yet create horrifying consequences. The ones that are affected the most are the children. CPS cannot continue to function in the same capacity. St. Lawrence County Social Work seems to rely on the resource within the county, which raises concern and question to corruption or biased decisions. There needs to be a deep investigation into a great detail to fix and make and correct this so no longer continues. We need to be able to have outside sources to be able to be allowed to be involved, which St. Lawrence County doesn't like to seem to have outside sources because they play by their own rules. CPS also needs to have more education on the latest information that's provided out there to the public. One example I will give you is the term gatekeeping, or also known as alienation, a term that is loosely used but seems to play as an ace in the CPS pocket. Alienation is most understood as bad, which in fact it can be. Dr. William G. Austin states parental gatekeeping in a different light. Restrictive gatekeeping, this is harmful to the child. Yes, very true. Yeah. This is when a parent is trying to minimize the other parent's involvement with the child without just justification. When a parent engages in restrictive gatekeeping, and there are sound reasons, to limit the other parent's involvement, such as when there is history of intimate partner violence, substance abuse, alcohol abuse, or harsh parenting, then the parent is engaging in protective gatekeeping, and this is justified. This is actual good parenting. When asked up to the CPS workers if they knew the difference between the gatekeeping, not one could answer it at all. Basic information, do a little digging. I found it, why can't you? Another, as you guys know, October is National Domestic Violence Awareness Month. In many situations, where the victim leaves their abuser, the child is left behind because of society and a system that does not understand. It's a myth when stated that it does not affect the child or children. Many children exposed to violence in a home are also victims of physical abuse in one shape or form. Children who witness domestic violence are victims of abuse themselves or at risk for long-term physical and mental health problems. Children who witness violence between parents may also be at greater risk of being violent in their own future relationships. Domestic violence affects children in some cases psychologically. The lack of emotional support can lead to heightened fear, anxiety, depression, anger, post-traumatic stress, social withdrawal, use of drugs, alcohol, and may become suicidal. The emotional wounds of domestic violence are devastating, yet the signs are ignored and labeled as it's just two parents that simply can't get along. As in a recent news, as we all know, thank you, I'm almost done. Gabby Petito, death is shedding light on domestic violence. The warning signs were there, but because of lack of understanding, matter went ignored. I'm almost done, I promise. Let's not ignore the signs. Let's be part of the solution and continue. Be part of the solution. Don't create the problem. Let's make the fixes here. Thank you.
Say your name at the podium. Stay there.
Good evening. My name is Erica Porter. I come all the way from Watertown, New York tonight to give you a very brief overview of the sad reality that my family has been faced with at the hands of St. Lawrence County DSS. I believe it's important that you know that the misconduct in St. Lawrence County is not only affecting families and children that live in your county. My husband, Jameson Porter, is a lifelong resident of Jefferson County, and his family owns a local farm there. I've lived there for the better part of a decade, moving there right after I finished my studies at St. Lawrence University in 2014. The grievous abuse of power in St. Lawrence County DSS has completely ripped our family apart. I believe the common link between St. Lawrence County DSS and those who have been wronged in surrounding counties is the foster care agency, CHJC. Even prior to our marriage, James and I knew that the impact we would have on kids as teachers would not be enough for us. We fostered 11 children through CHJC since we became certified foster parents 1 month after the birth of our biological child in 2019. Being teachers, we were highly regarded with respect by those in the agency and by most local DSS offices, and we were called to consider placement of some of the most difficult, horrendous situations. Fostering was a huge joy in our lives and brought 3 pre-adoptive children into our home. The children were with us for nearly 2 years, watching our biological son grow and forming sound, nurturing relationships with our immediate and extended families. Our love for them was so evident that the biological mothers of these children consented to our family adopting them. These children called us mom and dad and openly and often talked about their longing to be adopted by us. This all changed when St. Lawrence County DSS began targeting our family, retaliating against us for meeting with a local assemblyman to express our concerns primarily with the for-profit foster care system and the lack of support that local foster care agencies like CHJC offer to foster parents. Additionally, the county threatened to remove the children from our home if we did not stop advocating for our foster children's older siblings to be placed with us. We went so far as filing for guardianship for their brothers in family court so that their biological family did not need to be split up. Right now, as I stand here speaking to you, there are 4 siblings in care in 4 separate homes and institutions. DSS has failed these children over the past 4.5 years that they've been in foster care. They never sought to reunite these siblings. They denied the siblings visitation for the better part of 2 years. Over the course of the past 5 months, we've gone from being one of the most well-respected foster homes in the area to being investigated by CPS. 2 teachers. Evidence was fabricated or coerced from the children so that they had evidence to justify removing them from our care. Our 3 foster and pre-adoptive children have been taken from us, and all 3 are now in separate places. One of them is in St. Lawrence Psychiatric Center due to escalating behaviors after she was removed from our home. I strongly believe that we have enough evidence to win at our fair hearing for the removal of the children. However, our foster home was closed without our consent and without notice. without regard for the absolute crisis in the area and that you are facing with a lack of foster homes. Children are being institutionalized due to a lack of appropriate placements, while the home of 2 teachers with spotless reputations is closed. And one of my foster children sits in a home with a woman who was convicted of a DWI. Even if we win at a fair hearing on the removal of our children, they can't be returned to us because CHJC worked in partnership with St. Lawrence County DSS to close our home, and foster children can't be returned to homes that aren't certified. We're currently in the process of appealing that arbitrary and capricious removal of our pre-adopted foster children by St. Lawrence County DSS. And one day when our family is reunited, because we will be reunited, I hope this nightmare will be a distant memory for us. However, for many biological foster and adopted families in St. Lawrence County and surrounding counties, this is a nightmare with no end. Their families have been torn apart, children have been taken, misconduct has been covered up, and the law either could not protect them or failed to do so. I kindly ask you to look into the allegations of misconduct in St. Lawrence County, as this misconduct is not only affecting residents of your county. Residents of surrounding counties, good people, pillars of the community with spotless records are being targeted as well. I would ask that you issue a public statement addressing the issues, denouncing the wrongdoing of St. Lawrence County DSS agents who are representatives of your community and of our state. DSS and CPS are supposed to protect the children, but DSS is causing more trauma to the very children they have sworn to protect. I ask that you don't let it continue for one more day. Thank you.
Dan's plan? Not prepared. Courtney Fantone.
My name is Courtney Fantone, and I am the founder and director of Child, an organization that I think you're all well aware of at this point. I'm standing in front of you today because St. Lawrence County has a myriad of problems that we need to figure out. It starts with our emergency psychiatric centers being overfilled with children, more foster children than we have foster homes, dying children, and a derailed Department of Social Services that needs to be reined back in. I hold in my hand a pile of personnel complaints against St. Lawrence County Department of Social Services. But these are just a small portion of the calls that I've received, which now number high into the hundreds. There is corruption in our Department of Social Services, and I'm hoping that this will help solve that. These complaints will be filed with the St. Lawrence County Department of Social Services, St. Lawrence County Legislators, the Attorney General, as well as OCFS. I recently saw a comment online that said, how can child be upset that so many children are being placed in care and also that they are being left in dangerous situations? We unfortunately live in a world where those two things can occur simultaneously. Show of hands, who has ever taken a multiple choice test? Apparently not social services. I think we can all agree that the more effort we put into studying for this test, the more answers we're going to get right.
Yeah.
That being said, if we choose not to study for this test and just guess at our answers, we'll get some right, but we'll also get some wrong. By CPS doing the bare minimum when it comes to these investigations, we are getting it wrong. Unfortunately, the outcome of this is much worse than just failing a test. The information I'm going to talk about next comes from OCFF's own reports. First, I would like to look at CPS investigation timelines. In 2020, New York State as a whole closed 72% of their CPS cases during a mandatory 60-day period. Only 10% remained open past the 90-day mark. However, St. Lawrence County only closed 31% of their CPS cases in the 60-day period. Remaining 45% were open past 90 days. This is unacceptable. This is why children die. Next, we look at foster care admissions. New York State as a whole saw a 30% decrease in foster care admissions between 2017 and 2020. St. Lawrence County saw a 44% increase. If we look at the total number of children in care, New York State during the same period saw a 7% reduction, while St. Lawrence County saw an 86% increase. To put that into perspective, Jefferson County has a population of 109,000, where St. Lawrence has 108. While Jefferson County also saw an increase, it was only 31%. These are not my numbers. These are New York State's numbers, and they should alarm you because it's indicating to us that St. Lawrence County DSS is failing, and you are failing miserably. This is not about politics. This is not about choosing sides. This is about us as human beings coming together and saying, how can we do better? I do not receive a paycheck for the work that I do. I take no joy in reading endless court petitions, progress notes, and child fatality reports. I can walk away at any time, but I choose not to. I choose to listen to the broken families, the disgusted caseworkers, and the traumatized children. I choose to do this because for too long, too many people closed their eyes and walked away. We've all heard the phrase, the system is broken, but we have to refuse to accept that. I hear my work being referred to as commotion, and although I do not appreciate that, I have to ask, why aren't more people making a commotion? Why aren't you making a commotion for the girl who won't see her 11th birthday because she was chronically neglected? Or the boy who won't see his 14th birthday because nobody ordered mental health services? For the woman whose children are in foster care because she was punished for seeking help, escaping a domestic violence relationship? For the nonverbal boy who can't tell his mother that his father's hurting him? Or to the little girl who's afraid to tell on daddy because he threatens her? For the mother who's fighting so hard to get services for her daughter and is being met with resistance? For the little boy growing up in a stranger's home because his grandparents are fighting for placement with him and they're perfectly suitable to do so, but are being rejected? And for the foster parents who are closing their homes in disgust, or worse, the ones who are being closed because they zealously advocated for their foster children. I am asking you tonight to make some commotion, because if we don't stand up for our children, who will?
Dalton Morehouse.
Mine is pretty personal, but I'll keep names up. My name is Dalton Morehouse. I'm a former military police officer of 10 years in combat service in Iraq. And the father of 3 beautiful children. Over the past several years, my ex and mother of my 2 eldest children have been subjects to multiple CPS complaints and investigations, including one made in June 2020 where she punched my 6-year-old daughter in the face and threw her out of the house. At the time, the babysitter made a CPS complaint, and the very same day that the CPS investigation started, my ex was held on a 72-hour mental health hold by law enforcement. When the CPS investigator showed up to my door, I felt like something was going to be done to help my kids. I showed them calendars and books and entries notating the actions and issues that she has created over the past year and the steep decline in her mental health. I found out quickly that I was very wrong. The CPS investigator interviewed her one time at the hospital and scheduled every home visit that she had weeks prior to them showing up, and was perfectly okay with her canceling out on them at the last minute. After the first meeting with the CPS worker, I was deemed the safe place for my children. That was until he met with my ex. After he met with my ex, I was demanded to sign medical release forms from the VA, or I would lose the kids. And that was after I provided them with a mental health evaluation that I got done 3 days prior to them coming to my house. The only reason why any of this happened is because my ex is a DSS employee, and she has been given way more of way more of a background than anybody else. Nobody in this county is given a week's notice of a home visit. When I'm getting a phone call saying, I'm in your driveway. Okay, well, I'm in Augsburg. Well, you got 20 minutes to get here. On multiple occasions. He talked to her one time, didn't do any of the home visits that they were supposed to do. Then I received a message from her when she returned from work after her mental health leave, saying that she talked to the investigator at work in the hallway and he's dropping the case. I don't know how somebody gets away with punching a 6-year-old daughter, my 6-year-old daughter in the face and throwing her into the yard. And the saddest thing out of this whole thing is my 6-year-old packed all of my 4-year-old's toys because she did not want him to go without any toys.
It's criminal.
This is the kind of stuff that's happening in this county, and this is why this good old boy system needs to be tore down.
Carolyn, maybe, can't read the writing. Carolyn?
Haley.
Christina. Pronounce your name when you get to fill in the whole understand.
Hi, my name is Kaylee Meyer. I do not have much written down because I didn't know what I was exactly walking into. One thing I have heard though since listening is accountability and a broken system. And I can tell you first and foremost, that is something that needs to be addressed. I present to you my case, which is on the opposite end of everything we've heard. We were unfounded. We were good parents. Our kids were not there. But the system left us in a situation that we should never have been put in. We have lost financially. We have lost almost a promotion for my husband. And we were under the emotional distress that we were accused of putting kids under. And why? Because the system failed. The investigation process from said start, you're supposed to have your 24-hour safety assessment, which we had. In fact, I believe I met you. You were my father. And she was wonderful. But when I requested my records, there's no note of us meeting at all. That has been removed. So where is that? Where is that accountability? I then asked, the worker, she said, we will be in touch. We'll have the house assessment. We wanted it. We were more than welcome to this process. I am a healthcare worker. I'm a mandated reporter. I see kids go through this. I want them to get the services they deserve. And I deserve that due process as well. Our worker did not come back. In fact, I had to call. My husband had to call. We called multiple times over a week and a half after receiving our notification notice well past that 1 week. Our case was started on May 17th. We received our notice on July 2nd. Where is that 60 days? Where is the accountability for when you do not meet those processes? Your statement, I loved it. That's the kind of worker I want. That's the kind of workers I want to see more of. But that's not what we have. No, that was not her statement. We finally, after talking to our worker, well past 60 days, had her come to the home after providing her with collateral contact information, after providing her with release of information. I don't get paid to do her job. I get paid to do mine, but yet I'm the one who has to dig up information. There was no safety assessment. There was no follow-up. Not only that, but the narrative changed from each conversation, which I had with supervisors as well. And every recording is different. The final straw to continue finding out what happened, because our case finally just closed, I believe, 2 weeks ago. After waiting and fighting and calling. And for us to call, we had to use an app that changes your number to a kids' corner pediatric clinic to answer, to the DA to answer. Because otherwise there was no answer. There was no answer to emails. I wanted my children's doctors to be met. I wanted them so that this emotional distress charge could be proven for what it really was. My daughter who has mental health issues throwing a tantrum because that's what she does. She's 14. She has mental health workers. We more than offered that. She has all of their grades for the last year. There was no psychological evaluation to prove this distress. There was no follow-up with any of the services they received. How is that fair? I lost probably 15, 20 pounds. I've experienced multiple episodes of tachycardia, nausea. My job work declined. I did not get sleep because here I am questioning myself as a parent. Am I doing right by the people I take care of day to day if I'm not serving them what they need? How is that fair? Well, how is that, what are we gonna do about it? That's my question. An investigation, more staff, great. But then what about these processes that aren't being met? What about continued education for them? What about implementation that supports documentation submissions? So there is none of these narrative changes, so that there is accountability. I've not heard anything of that. All I've heard is, we'll investigate it. How is that fair to us?
Rachel Ray. Okay. We have another list here, but I think a lot of those people were here for the historian get together, but I'm gonna check some of the names. Lenore? Lenore's on here? No? Different list then. Who wants to speak that has not signed it? Anyone? We've all spoken? That's good, thank you. Thank you for coming.
I got another 5 minutes.
Next on the agenda. Presentation.
Oh, Bill, we do have one more video request that was sent in that we'll have to play. One more video. It was a audio recording sent in for public participation.
Okay.
Dylan will play it. Sorry about that.
Hello, my name is Dottie Spears. I sent a voice message to this board in July. I am the mother of a child placed in foster care with a DSS employee. I could provide documentation to prove that there was a safety plan in place for my grandson, and it was for my husband and I to have custody, which the planning began back in September of 2020. I implore each one of you to reach out to me to see the proof of this. I requested an ICPC to be completed back on January 15th, 2021, the same day my grandson was stolen from my son directly out of the hospital. On this day, a senior supervisor had stated that an ICPC takes up to 6 months. We are now almost 9 months later. On June 4th, it was told to the family court that the ICPC was in Tennessee where I reside. That was a lie. It did not get to Tennessee until approximately June 24th. In a report dated January 19th, it was stated that, quote, there is no non-custodial respondent, parent, relative, and it goes on, end quote. That was a lie. Can anyone please tell me how that is stated when I was in contact with a senior supervisor 4 days prior? I am pleading with you, the lawmakers, for an explanation as to why my grandson has not been able to be placed with his paternal family. Our family has had to endure missing all of my grandson's first bath, first time sitting up, first time crawling, first time beginning to pull himself up, first time being fed with a spoon, his first vaccinations where he could not be comforted by his family. As of this writing, the caseworker has been requested to provide dates and pictures of the first that have been forcibly missed, and she still has not even responded to this request. This poor child will have a baby book without his infant years being documented, as if he didn't even exist. Can you also answer why this DSS employee has already stated she wants to adopt my grandson when DSS is supposed to emphasize reunification? Or when he has grandparents who are more than wanting him to be raised with family without compensation? Another concern I have is why was the county attorney placed in charge of DSS legal department? Is this not a conflict of interest? How is he supposed to represent people of the county as well as represent a government entity without prejudice? This is directed to Mr. Lightfoot. Can you please provide a summary as to the qualifications of the Bonadillo group that you are tasking with the comprehensive review of children's services and DSS? Then, here's this. There are 15 of you that have been elected and paid to oversee all aspects of the county government. The two key words there are elected and oversee. Let that sink in for a moment. This does not mean protect DSS, Mr. Burke. You are all in charge of overseeing that all of our children are being cared for and properly placed when intervention is needed. It is my belief that you should all be charged with child trafficking since you all have allowed my grandson to be placed in a home that gets paid to care for him. You all have failed my grandson, and for that, I will have an extremely hard time forgiving. We, as adults, have a responsibility to be advocates for the children that are not given a voice. There have been 2 deaths of children in your county, and no one knows if there are more because they slipped through the cracks or they have not been reported properly. I will not allow my grandson to continue to be a statistic in a corrupt system that claims to be there for children's safety, when in fact there appears to be a multitude of children being failed and fall through the cracks. My fight will continue to be placed before your board until drastic changes are implemented for all children's protections. Children's trauma needs to end at the government's hands. Tonight, Mr. Lightfoot will be asking for an increase for social services. Mr. Lightfoot, what happened with Family First and kin placement? I will request that your legislative board look into my grandson's case and determine that there is no legal reason why DSS has continued to maintain holding my grandson hostage in foster care with a DSS employee that is being paid an extraordinary amount of funds, when we should be placed with his family that are requesting no no compensation for his care. I would like to thank you for your time. Good night.
I think that should have been heard by the full group. Dismissed early. What's that? I said, I think that should have been heard by the whole group that was here.
Are there more of us?
That was part of communication. Why didn't everybody get to hear that?
They could have.
They walked out on their own, nobody asked
He
anybody.
told them to leave. He said,
Yes, you did.
Yeah, I heard. He said it was
You said he thanked
He
everybody.
said it was the end of the communication.
It's on video. They can watch it on video.
Oh, well, he said it was the end of communication.
All right. Presentation of resolutions.
Is there more?
Ms. Curran.
Yes, Mr. Chairman, can you hear me?
Barely, but I can hear you. It's a little loud out there in the hall, but it'll quiet down probably within 5 minutes.
I have an authorization or a resolution authorizing the chair to sign a contract with New York State Division of Criminal Justice Services for a fiscal year 22 alternative to incarceration pretrial electronic home monitoring grant, and I move this resolution.
Seconded by Mr. Perkins. Any discussion? No discussion? All in favor?
Aye.
Opposed? Carried. Ms. Curran.
Mr. Chairman, I have a resolution authorizing the chair to sign a contract with Casella Waste Services at Harrogate Building for the District Office of Probation Department of Services, and I move this resolution.
Second by Mr. Perkins. Any discussion? No discussion. All in favor?
Aye.
Opposed? Carried. Mr. Kern.
Mr. Chairman, I have a resolution declaring October as Domestic Violence Awareness Month, and I move this resolution.
By Mr. Akers. Any discussion? No discussion. All in favor?
Aye.
Carried. Ms. Kern.
Mr. Chairman, I have a resolution modifying the 2021 budget for the St. Lawrence County Clerk's Office for overtime costs at the Department of Motor Vehicles, and I move this resolution.
Seconded by Mr. Perkins. Any discussion? No discussion. We have a roll call vote.
Fay,
Yes.
Haggard,
Yes.
Fiaco,
Yes.
Burke,
Oh, John.
None, yes or no on this resolution? Thank you, Bill. Yes, I'll myself.
Arquette,
Yes.
Terminelli,
Yes.
Curran,
Yes.
Reagan,
Yes.
Forsythe,
Yes.
Lightfoot,
Yes.
Sheridan,
Yes.
Smithers,
Yes.
Denisha,
Yes.
Perkins,
Yes.
Akers,
Yes.
15 yes.
Carried. Ms. Kern.
Mr. Chairman, I have a resolution modifying 21 Sheriff's Office for Council 82 AF DME Local Number 2390 Contract Settlement for Uniform Maintenance, and I move this resolution.
Seconded by Larry Denisha. Any discussion? No discussion. We have a roll call.
Haggard,
Did you say Haggard?
yes.
Yes.
Fiaco,
Yes.
Burke,
Yes.
Arquette,
Yes.
Terminelli,
Yes.
Curran,
Yes.
Reagan,
Yes.
Forsythe,
Yes.
Lightfoot,
Yes.
Sheridan,
Yes.
Smithers,
Yes.
Denisha,
Yes.
Perkins,
Yes.
Akers,
Yes.
Fay,
Yes.
15 yes.
Carried. Ms. Kern.
Mr. Chairman, I have a resolution modifying the 2021 budget for the Sheriff's Office for 82 AF DME Local Number 2390 for contract settlements for salaries, and I move this resolution.
Seconded by Mr. Burke. Discussion? No discussion? Roll call.
Fiaco,
Yes.
Burke,
Yes.
Arquette,
Yes.
Terminelli,
Yes.
Curran,
Yes.
Reagan,
Yes.
Forsythe,
Yes.
Lightfoot,
Yes.
Sheridan,
Yes.
Smithers,
Yes.
Denisha,
Yes.
Perkins,
Yes.
Akers,
Yes.
Fay,
Yes.
Haggard,
Yes.
15 yes.
Carried. Ms. Kern.
Mr. Chairman, I have a resolution modifying the 2021 budget for the Sheriff's Office for medical doctor malpractice insurance coverage at the correctional facility, and I move this resolution.
Seconded by Mr. Perkins. Any discussion? No discussion? Roll call vote.
Burke,
Yes.
Arquette,
Yes.
Terminelli,
Yes.
Curran,
Yes.
Reagan,
Yes.
Forsythe,
Yes.
Lightfoot,
Yes.
Sheridan,
Yes.
Smithers,
Yes.
Denisha,
Yes.
Perkins,
Yes.
Akers,
Yes.
Fay,
Yes.
Haggard,
Yes.
Fiaco,
Yes.
15 yes.
Carried. Ms. Kern.
Mr. Chairman, I have a resolution modifying the 2021 budget
for the sheriff's office for 207C compensation. I move this.
Seconded by Mr. Lightfoot. Any discussion? No discussion? Roll call vote.
Arquette,
Yes.
Terminelli,
Yes.
Kern,
Yes.
Reagan,
Yes.
Forsythe,
Yes.
Lightfoot,
Yes.
Sheridan,
Yes.
Smithers,
Yes.
Denisha,
Yes.
Perkins, Akers,
Yes.
Fay,
Yes.
Haggard,
Yes.
Fiaco,
Yes.
Burke,
Yes.
15 yes.
Carried. Ms. Kern.
Mr. Chairman, I have a resolution modifying the 2021 budget for the sheriff's office for overtime expenses for the correctional. And
Seconded by Mr. Perkins. Any discussion? No discussion? Roll call vote.
Terminelli,
Yes.
Curran,
yes.
Reagan,
Yes.
Forsythe,
Yes.
Lightfoot,
Yes.
Sheridan,
Yes.
Smithers,
Yes.
Denisha,
Yes.
Perkins,
Yes.
Akers,
Yes.
Fay,
Yes.
Haggard,
Yes.
Fiaco,
Yes.
Burke,
Yes.
Arquette,
Yes.
15 yes.
Resolution carries. Ms. Kern.
Mr. Chairman, I have a resolution modifying the 2021 budget for the sheriff's office for the purchase of body and security cameras for the correctional facility, and I move this resolution.
Seconded by Mr. Perkins and Mr. Denisha. Any discussion? No discussion? Roll call.
Curran,
Yes.
Reagan,
Yes.
Forsythe,
Yes.
Lightfoot,
Yes.
Sheridan,
Yes.
Smithers,
Yes.
Denisha,
Yes.
Perkins, Akers,
Yes.
Fay,
Yes.
Haggard,
Yes.
Fiaco,
Yes.
Burke,
Yes.
Arquette,
Yes.
Terminelli,
Yes.
15 yes.
Resolution carries. Ms. Kern.
Mr. Chairman, I have a resolution modifying the 2021 sheriff's office budget to accept a 2022 police traffic service grant from New York State Traffic Committee, and I move this resolution.
Seconded by Joe Lightfoot, Larry Denisha. Any discussion? No discussion? Roll call, please.
Reagan,
Yes.
Forsythe,
Yes.
Lightfoot,
Yes.
Sheridan,
Yes.
Smithers,
Yes.
Denisha,
Yes.
Perkins,
Yes.
Akers,
Yes.
Fay,
Yes.
Haggard,
Yes.
Fiaco,
Yes.
Burke,
Yes.
Arquette,
Yes.
Terminelli,
Yes.
Curran,
Yes.
15 yes.
Resolution carries. Ms. Kern.
Mr. Chairman, I have a resolution modifying the 2021 budget for the Office of Emergency Services for a computer-aided dispatch and records management technology service program. Move this.
Seconded by, seconded by, nobody on the screen. Okay, Mr. Lightfoot, any discussion? No discussion, roll call.
Forsythe,
Yes.
Lightfoot,
Yes.
Sheridan,
Yes.
Smithers,
Yes.
Denisha,
Yes.
Perkins,
Yes.
Akers,
Yes.
Fay,
Yes.
Haggard,
Yes.
Fiaco,
Yes.
Burke,
Yes.
Arquette,
Yes.
Terminelli,
Yes.
Curran,
Yes.
Reagan,
Yes.
15 yes.
Resolution carries. Ms. Kern.
Mr. Chairman, I have a resolution supporting Senate Bill S 4104 and Assembly Bill A 706 and implement general business law in relation to the sale of digital electronic equipment and providing diagnostic repair information known as the Digital Fair Repair Act. And I this resolution.
Seconded by Mr. Smithers. All in favor? Oh, discussion. And Mr. Akers, do you want to second that too?
I'd like to discuss this also.
Okay, discussion?
Yes, thank you, Mr. Chairman. Over 400,000 phones per day are thrown away in the United States. Certainly they have not reached the end of their life. They just have a problem that can be fixed, and this waste that's being generated by the inability to allow repairmen to fix these telephones, but also particularly in the ag equipment, it's getting so that everything now is computerized and controlled by software. Sometimes the software just needs somebody, the farmer himself can actually, if he had the tools and the rights to actually repair this equipment, it would be very helpful and move forward to improve on this technology. And so I wholeheartedly support this resolution.
Any further discussion? All in favor?
Aye.
Opposed? Carried. Ms. Kern.
Mr. Chairman, a resolution opposed COVID-19 vaccine imposed by federal, state, or local governmental bodies, and I move this resolution.
Seconded by Mr. Akers. Any discussion? No discussion? All in favor?
Aye.
Opposed?
No.
Mr. Burke opposes. And
Mrs. Haggard.
Nicole? Got you, Nicole. No vote. Ms. Haggard?
Thanks,
No
Joe.
vote. I think that's it. Motion carries. Right, resolution carries. Mr. Lightfoot.
Mr. Chairman, I offer a resolution authorizing the chair to sign an extension of the contract for one-time grant funding from New York State opioid response for a mobile treatment vehicle and move for its adoption.
Seconded by Mr. Smithers. Any discussion? I don't see any discussion, so all in favor?
Aye.
Opposed? Carried. Mr. Lightfoot.
Mr. Chairman, I offer a resolution proclaiming October 20th, 24th through the 30th, 2021 as National Lead Poisoning Prevention Week. Move for its adoption.
Seconded by Mr. Smithers. Any discussion? No discussion, all in favor?
Aye.
Opposed? Carried. Mr. Lightfoot.
Mr. Chairman, I offer a resolution authorizing the chair to sign a contract with the New York State Department of Health for COVID-19 vaccine response and modifying the 2021 budget for the Public Health Department and move for its adoption.
Seconded by Ms. Kern. Roll call. No, discussion. Let's have a discussion. Any discussion? Roll call.
Lightfoot,
Yes.
Sheridan,
Yes.
Smithers,
Yes.
Denisha,
Yes.
Perkins, Akers,
Yes.
Fay,
Yes.
Haggard,
Yeah.
Fiaco,
Yes.
Burke,
Yes.
Arquette,
Yes.
Terminelli,
Yes.
Kern,
Yes.
Reagan,
Yes.
Forsythe,
Yes.
15 yes.
Resolution carries. Mr. Lightfoot.
Mr. Chairman, I offer a resolution authorizing the chair to sign a contract with St. Lawrence Health for ward and laboratory services and move for its adoption.
Seconded by Mr. Smithers. Any discussion? All in favor?
Aye.
Opposed? Carried. Mr. Lightfoot.
Mr. Chairman, I offer a resolution modifying the 2021 budget for social services for child care / foster care administration and HEAP, and move for its adoption.
Seconded by Mr. Burke. Any discussion? No discussion. Roll call vote.
Sheridan,
Yes.
Smithers,
Yes.
Denisha,
Yes.
Perkins, Akers,
Yes.
Fay,
Yes.
Haggard,
Yes.
Piaco,
Yes.
Burke,
Yes.
Arquette,
Yes.
Terminelli,
Yes.
Curran,
Yes.
Reagan,
Yes.
Forsythe,
Yes.
Lightfoot,
Yes.
15 yes.
Resolution carries. Mr. Akers?
Thank you, Mr. Chairman. Mr. Chairman, I offer a resolution modifying the 2021 budget for the Department of Highways for the acquisition and construction of an equipment garage and sand/salt storage building in the town of Potsdam. I move this resolution.
Second by Mr. Denisha. Any discussion? Mr. Akers?
I'd just like to note that the previous two salt and sand buildings, we actually will be bonding for. Here, we're actually using funds that are in the fund balances for highway that'll be dedicated to this, and this will be a savings to the taxpayers of St. Lawrence County.
Any other discussion? Go ahead, Mr. Perkins.
I'll be abstaining.
Okay, noted. Any other discussion on the resolution? Okay, roll call, Kelly?
Smithers,
Yes.
Denisha,
Yes.
Perkins,
Abstain.
Akers,
Yes.
Fay,
Yes.
Haggard,
Yes.
Piaco,
Yes.
Burke,
Yes.
Arquette,
Yes.
Terminelli,
Yes.
Curran,
Yes.
Reagan,
Yes.
Forsythe,
Yes.
Lightfoot,
Yes.
Sheridan,
Yes.
14 yes, 1 abstained.
Resolution carries. Mr. Akers?
Mr. Chairman, I offer a resolution authorizing the acceptance of real property obtained by the state of New York relative to the County Route 35 known as Slab City over the Trout Brook Bridge Replacement Federal Pass-Through Project, PIN number 775394, PIN number 3341700, and move this resolution.
Seconded by Mr. Perkins. Any discussion? No discussion. All in favor?
Aye.
Opposed? Carried. Mr. Akers?
Mr. Chairman, I offer a resolution authorizing the collection of omitted taxes. I move this resolution.
Seconded by Mr. Lightfoot. Any discussion? No discussion? All in favor?
Aye.
Opposed? Carried. Mr. Akers?
Mr. Chairman, I offer a resolution for the adoption of the equalization rates for the 2022 county taxes. I move for its adoption.
Seconded by Mr. Lightfoot. Any discussion? No discussion. All in favor?
Aye.
Opposed? Carried. Mr. Akers?
Mr. Chairman, I offer a resolution authorizing real property tax law correction of errors. I move this resolution.
Seconded by Mr. Fay. Any discussion? No discussion. All in favor?
Aye.
Opposed? Carried. Mr. Akers?
Mr. Chairman, since I do not support the following resolution, I asked Vice Chairman Denisha if he would read this.
Mr. Denisha?
Mr. Chairman, I offer a resolution authorizing a settlement agreement between McKesson Corporation, Cardinal Health Incorporated, Amerisource Bergen Drug Corporation, PSS World Medical, Kinray LLC, Belco Drug Corporation, American Medical Distributors, Inc., in St. Lawrence County with respect to an action relating to the opioid crisis and move for its adoption.
Seconded by Mr. Lightfoot. Any discussion? Mr. Akers?
Mr. Chairman, I would not be supporting this resolution, and they'll be saying the same commitments to the other resolutions that came before this concerning this matter. Oxycontin is a legal drug that took tremendous amount of regulatory and financial hurdles to bring it to the market. And you cannot get this drug without a prescription. And the only way that you can get a prescription is through a doctor. Doctors who have had 8 to 10 years of medical school. And I think that the doctors, there aren't really very many, at least here locally, that have been held responsible. We know that we've had plenty of overdoses from Oxycontin and opioids. And the result of this will be limits to innovation. There will be drugs that will not be brought to the market, and there'll be increased costs to the consumer because of they got to recover this money. So it's a responsibility, I believe, lies with the doctors. They're the ones that are prescribing it, and I will be voting against this resolution settlement.
Any further discussion? Ms. Kern?
So yes, I would agree that we are the people who prescribed it, right? In the beginning, when drugs came out, they were, I guess, marketed to the providers as a way to finally be able to address your patient's pain at a time when the federal government assigned your pain score as your 5th vital sign and a strong motivator for how your billing was done. If you didn't address the patient's pain, they could say they didn't get what they wanted and you weren't going to get paid, or you were going to get nicked on your billing in an ER. So everybody trusted in the very beginning that the companies that created these drugs were telling us all the problems that there could be with them. And I don't think we knew back then how easy it was to hit somebody's mu receptor in their brain and turn on that addiction for people, and that all it took was just one pill to do that. So while yes, in the beginning, I think everybody used these drugs because they were trying to address pain. But I do agree that after a bit, when people started to see the problems they were causing, there were definitely people who continued to prescribe these drugs for their own personal financial gain. And yes, I would love to see those people addressed for the things that they did.
Any further discussion? All in favor?
Aye.
Opposed?
Aye.
Carried. Strikers.
Mr. Chairman, I offer a resolution for amending resolution number 14-2021, known as Bank Depositories and Investment of County Funds. I move this resolution.
Seconded by Ms. Kern. Any discussion? No discussion. All in favor?
Aye.
Opposed? Carried. Mr. Akers.
Mr. Chairman, I offer a resolution for authorization to modify the PY20 budget for the Workforce Innovation Opportunity Act. I move this resolution.
Seconded by Ms. Kern. Any discussion? No discussion. Roll call vote, please, Kelly.
Denisha,
Yes.
Perkins,
Yes.
Akers,
Yes.
Fay,
Yes.
Haggard,
Yes.
Diaco,
Yes.
Burke,
Yes.
Arquette,
Yes.
Terminelli,
Yes.
Kern,
Yes.
Reagan,
Yes.
Forsythe,
Yes.
Lightfoot,
Yes.
Sheridan,
Yes.
Smithers,
Yes.
15 yes.
Resolution carried. Mr. Akers.
Mr. Chairman, I offer a resolution authorizing the chair to sign the St. Lawrence County Local Workforce Development Area Local Plan and move this resolution.
Seconded by Mr. Fay. Any discussion? No discussion. All in favor?
Aye.
Opposed? Carried. Mr. Akers.
Mr. Chairman, I offer a resolution authorizing the Group Health Plan Administrator for St. Lawrence County to submit a claim against Blue Cross Blue Shield regarding a class action settlement. I move this resolution.
Seconded by Ms. Kern. Any discussion? No discussion. All in favor?
Aye.
Opposed? Carried. Mr. Akers.
Mr. Chairman, I offer a resolution proclaiming October 2021 as Cybersecurity Awareness Month in San Lawrence County. I move this resolution.
Seconded by Ms. Kern. Discussion? All in favor?
Aye.
Opposed? Carried. Mr. Akers.
Mr. Chairman, I offer a resolution calling upon New York State Governor Kathy Hochul and Commissioner of the Office of Temporary Disabilities Assistance to expedite the release of Emergency Rental Assistance Program, known as ERAP, funding to provide relief to those impacted by the COVID-19 pandemic eviction restrictions and eviction moratorium. I move this resolution.
Seconded by Ms. Kern and Mr. Reagan. Any discussion? No discussion, all in favor?
Aye.
Opposed? Carried. Mr. Akers.
Mr. Chairman, I offer a resolution calling on the state of New York to increase and fully fund County Law 18B, assigning council statutory pay levels. I move this resolution.
Seconded by Ms. Kern. Discussion? Mr. Lightfoot.
I'd like to be added as a co-sponsor to this resolution, please.
So noted. Any more discussion? All in favor?
Aye.
Opposed? Carried. And Mr. Akers?
Mr. Chairman, I offer a resolution calling on the governor to complete Affordable Care Act enhanced federal and Medicaid assistance percentage reconciliations that are years overdue and immediately release the federal funds owed to the counties and New York City. I move this resolution.
Seconded by Ms. Kern. Any discussion? No discussion, all in favor?
Aye.
Opposed? Carried. Mr. Akers.
Mr. Chairman, I offer a resolution calling on the governor and the legislature to suspend any further state diversion of local sales tax for distressed health facilities and to work immediately to sunset the law. I move this resolution.
Seconded by Ms. Kern. Any discussion? Mr. Lightfoot.
I'd like to be added to this resolution as a co-sponsor also.
So noted. Anyone else? Ms. Kern.
I would also like to co-sponsor, please.
So noted. All in favor?
Aye.
Opposed? Carried. Mr. Akers.
Mr. Chairman, I offer a resolution urging the state of New York and the federal government to expand true broadband coverage to all New Yorkers. I move this resolution.
Seconded by Ms. Kern. Any discussion? Go ahead, Mr.
Thank
Denise.
you, Mr. Chairman. First, I would like to ask the co-sponsor of this resolution. And I just want to speak to the same as I spoke in committee. As everyone knows, my legislative district is largely rural. And it's the rural areas are the areas that are really underserved. During the presentation by Dan last week, I know they talked about the number of households per mile. I think a few years ago it was 2 to 5, and now it's up to 10 households per mile before they can make any, the providers can make any money. And there's many areas in St. Lawrence County, particularly the larger districts, that you don't have that many homes per mile. Often you'll have maybe one home every 2 or 3 miles. Those homes have children that are trying to go to school remotely. It's really difficult if you don't have access to high-speed internet. We're trying to attract businesses to St. Lawrence County. And it's really difficult to attract businesses if we don't have the basic services. So, it's, as I said, in 2016, there was a great fanfare. It was announced that we were going to have everyone in New York State was going to have access to high-speed internet by the end of 2019. Well, here we are, almost the end of 2021, and we're still discussing it. So I certainly urge everyone to support this resolution.
Any further discussion? Mr. Lightfoot.
I'd just like to agree with what Larry just brought forward about the sparseness of service in the area. 3 of my townships, Oswegatchie, Morristown, and the town of Canton, happen to be deficient in the provision of and for Wi-Fi services. And I think it's important that it isn't just the bigger counties or the towns or the towns, within the blue line. It's a widespread thing, not only in Morristown, Oswegatchie, and Canton, and those other townships, but the whole county and the whole state. And it's time that those folks in Albany got off their back ends and did something about it, something that is measurable and visible, and not another survey. We need to see people putting up the equipment that we need to have Wi-Fi for everybody in this county and everybody in the state.
Ms. Haggard.
Thank you, Mr. Chairman. I certainly support this, and I believe that the infrastructure bill that is being discussed in Washington right now, proposed by the Biden administration, would support this type of infrastructure. And so I definitely would support this, particularly coming from an education background. I understand the need for broadband to be available to everyone.
Okay. Thank you. Any other discussion? No further discussion. All in favor?
Rita.
What, Rita? Rita, you have something? Go ahead.
So my district is like the Penny River district. And if you try and make a phone call between the Route 37 and 56 light going towards Waddington, you get disconnected about 5 or 6 times along the way. There are areas in my district that it's difficult to even make a 911 call in, that the people who plow at night are worried because they even have dead radio service due to lack of broadband and just general accessibility to it. So I would like to be added to as a sponsor to this, if I could, please.
So noted. Any other discussion? All in favor?
Aye.
Opposed? Carried. Mr. Akers.
Mr. Chairman, I offer a resolution calling for an increase in the share of revenue counties retain for providing State Department of Motor Vehicle Services. I move this resolution.
Seconded by Ms. Kern. Any discussion? No discussion. All in favor?
Aye.
Opposed? Carried. Mr. Akers.
Mr. Chairman, I offer a resolution calling on the state of New York to immediately make all municipalities whole in the St. Regis Mohawk Tribal Gaming Region that has been impacted by the lack of payment by New York State. And move this resolution.
Seconded by Mr. Lightfoot. Any discussion? Yes, Mr. Arkwood.
Thank you, Mr. Chairman. I'd like to be added as a co-sponsor on this resolution.
So noted. Mr. Lightfoot.
As would I, please.
So noted. Any other discussion? Okay, all in favor?
Aye.
Opposed? Carried. Mr. Akers.
Mr. Chairman, I offer a resolution calling on the state of New York to fully reimburse counties for district attorney salary increases that are set and controlled by the state. I move for this resolution.
Seconded by Mr. Lightfoot. Any discussion? No further discussion? No discussion at all? Okay, let's have a vote. Favor?
Yeah.
Opposed? Carried. Mr. Akers.
Mr. Chairman, I offer a resolution supporting a collaboration between the New York State Office of Mental Health, OMH, and the counties in planning and implementing a national 988 suicide prevention hotline. Move this resolution.
Second by Mr. Burke. Any discussion? Yes, Ms. Kern.
I'd like to be added as co-sponsor, please, Mr. Chairman.
So noted. All in favor?
Aye.
Opposed? Carried. Mr. Akers.
Mr. Chairman, I offer a resolution calling on Governor Kathy Hochul to restore the state-county share of the cost of 730.20 competency restoration services and make reforms to the program thereto. Move this resolution.
Second by Ms. Kern. Any discussion? Ms. Kern?
Our inability in our area has to do with funding. These can be really expensive, lengthy stays to do restorative services, just to fully evaluate and see if the person is able to be involved in their own court case. And so I think that if we had the money, we could do much more with this. And I would like to be added as a co-sponsor.
So noted. Any more discussion? All in favor?
Aye.
Opposed? Carried. Mr. Akers.
Mr. Chairman, I offer a resolution calling on the governor and the legislature to end the diversion of county sales tax to pay for the state AIM program and begin work to reform the AIM program while restoring state funding responsibility. I move this resolution.
Seconded by Mr. Perkins and Mr. Lightfoot. Any discussion? Yes, Mr. Denisha.
Mr. Chairman. The only comment I want to make is the same one that I made in committee. The AIM funding, and this is from my experience as a town supervisor, the AIM funding is critical to our townships. Most of them have a very small budget, and the AIM funding was instrumental with highway work. I do not think it's right, it was right, the governor misdirected sales tax revenue from the counties to fund a state program. So I'm supportive of the resolution. However, I'm just urge caution that they don't just say, we will stop diversion of the sales tax and we are going to eliminate AIM funding. That's what I'm critical of. I hope that they see the error in their ways and we continue to fund the AIM money to towns, but the state funds rather than county money.
Mr. Akers.
I agree with legislator Denisha. The gist of the resolution itself is for the state to take back this responsibility. We're not advocating for the funding. I know my township in Madrid, to get about $10,000, and it is very important to all the local towns. But this is a pattern that the state's been doing. They start you out on a program, and then all of a sudden they're covering 75%, then next is 50%, and the next thing you know, it's right in your pocket, you're funding it. In this particular case, the towns push back hard. The Association of Towns has great lobbying results. They push back hard, and the governor laid it on the counties, and we ate it. So I concur with Mr. Denisha, but this is advocating for the state to take back its responsibility on the aid program.
Any other discussion? I'd like to be added as a co-sponsor to that comment. All in favor?
Aye.
Opposed? Carried. Mr. Akers.
Mr. Chairman, I offer a resolution authorizing the chair to sign an agreement with United Helpers, Inc. for space located at 100 Ford Street, Ogdensburg, New York, sign a business associate agreement and modifying the 2021 budget for the Department of Social Services. I move the resolution.
Seconded by Ms. Kern and Mr. Lightfoot and Mr. Reagan. And any discussion? Mr. Reagan.
I would just like to thank the county administrator for developing a program to put, as a pilot program, to put social services workers, human services workers closer to the people they serve. I think this is a great way to reduce the need to build additional space here where we have overcrowding problems. And, it'll be a great opportunity to see whether it works, see whether it helps reduce unnecessary travel between Ogdensburg and Canton. And if this program works, we may be able to duplicate it in other communities around the county to reduce the amount of travel that citizens have to make in order to get essential services. So I appreciate the fact that the county administration is working and trying to find innovative solutions to problems and try something new and see whether it works. So thank you.
Any other discussion? No further discussion. We have a roll call vote, Kelly?
Perkins,
Yes.
Akers,
Yes.
Fay,
Yes.
Haggard,
Yes.
Piaco,
Yes.
Burke,
Yes.
Arquette,
Yes.
Terminelli,
Yes.
Curran,
Yes.
Reagan,
Yes.
Forsythe,
Yes.
Lightfoot,
Yes.
Sheridan,
Yes.
Smithers,
Yes.
Denisha,
Yes.
15 yes.
Resolution carries. Mr. Akers.
Mr. Chairman, I offer a resolution adopting proposed local law C for the year 2021 for setting the salary for the county attorney. I move this resolution.
Seconded by Mr. Denisha and Mr. Perkins. Any discussion? No discussion? Yes, Mr. Akers.
I just want to say that I support this. 158,000 is how we arrived at that, was an average of the counties where the county attorney had dual duties of social services and legal. That data was brought by you, Mr. Chairman, and appreciate it. And also on another issue, our county attorney has been very supportive of the Second Amendment, and his active advocacy of that is very important, I think, to the constituents here of St. Lawrence County. Of a special note, we just had our sale. We were one of the few counties that were able to have our sale of foreclosed properties, and that generated 1.7 million, of which our costs were 900,000. And by doing so, we were able to generate $811,000 that, if he hadn't been so timely in getting the paperwork done to implement this sale, we would have been holding for another year on the taxes on these foreclosed properties. So it's a great savings. Mr. Botten is ambitious and hardworking, and I think he fully deserves this salary.
Any other discussion, Mr. Lightfoot?
Yeah, I just want to raise an objection to that section 2, where it says, for the legal unit in the Department of Social Services is relocated, a review of the compensation will occur, and the salary will be returned to the prior level. I don't see where we need both of those in there, to be honest with you. If we're going to review the compensation, why do we have the mandate that the salary will be returned to the prior level? It seems like it's an automatic. I don't particularly want to see the automatic stand alone there. I'd much rather see it end with a review of the compensation will occur, period. And I would offer to make an amendment to that fact.
Mason's motion's been moved, or the amendment been moved by Mr. Lightfoot, seconded by Mr. Denisha. All in favor of that amendment?
Discussion on the amendment.
One more time?
No, it's a discussion on the amendment.
Okay, discussion on the amendment? Any discussion on the amendment? Yes, Mr. Lightfoot.
Well, all I can do is reiterate what I said. If we're going to review it, why are we already stating in the particular resolution that the salary will be returned to the prior level? If we're going to review it, that's the purpose of a review, is to see what, if anything, should happen. That is my reason for this amendment, and certainly hope it will be found in favor by the rest of the board.
Mr. Anchor.
It's kind of tomato. I mean, basically what it's saying to the public that should those duties, one or the other, disappear, that in all likelihood, that job title would result in a lower compensation. But for the sake of harmony, I would support Mr. Lightfoot's amendment.
So just to be clear, your motion is to put a period after the word occur and delete the rest of that sentence?
Yes, sir.
Got it.
I think would Ruth like to talk about it?
Ruth, did you want to speak to it, Ruth?
Sure, the amendment, I think doesn't change the intent. The interest was in having a review or language to include if the responsibilities change, would not be an automatic assumption that the salary would remain.
Who's talking? That's Ruth. That's Ruth. Ruth, your mouth was not moving, Ruth, but we can hear you. Picture's frozen.
Can you hear me now?
Picture's frozen.
Your picture's frozen.
Turn your video off.
I think
Turn the video off.
Yeah.
Turn the video off.
Turn the video off, Ruth.
the boardroom keeps interrupting now.
Ruth must be in one of those bad broadband areas.
Got it.
Okay. We have an amendment on the floor. And is there any more discussion on the amendment?
Like you said, forgot. This isn't a matter.
Who's talking?
Is there anything we
Is
can
that
do about
better?
this?
Oh, yes.
Can you hear me better?
Yes.
Now we can.
Can you hear me at all?
Yes. Yes.
Now we can.
Can't hear
I
us.
think I am.
He was always on the outside of the big money.
Who's talking, Ruth?
I don't know who's talking.
There's audio coming through Tony's.
Oh, it's coming through Tony's?
Yeah.
Tony, there's
Tony,
audio
you're
coming in from your setup.
He just muted.
Ask Ruth again.
Ruth, would you like to say what you wanted to say?
Can you hear me at all?
See, it wasn't my fault. You wanted to blame me for it.
Apology issue.
Ruth, you sound much better in person. What's your?
I call the question.
I just call the question, okay. So let's call the question. All in favor of calling the question? Do we have to vote on that? Yeah. All in favor of calling the question?
Aye.
Anyone opposed to calling the question? Okay, so the amendment's on the floor to change it the way Mr. Lightfoot wanted it changed. And Mr. Smithers, you're all right with understanding exactly what's happening now. And so let's vote on that amendment. We're voting on Joe Lightfoot's amendment. And all in favor of Joe Lightfoot's amendment? All in favor?
Aye.
Anyone opposed? Is anyone opposed? Mr. Burke is opposed. Ms. Haggard's opposed. Anyone on the screen? Okay, so the amendment passes. So now that the amendment's passed, now we'll vote on the resolution as amended. Let's go ahead, Mr. Smith.
Yes. I was impressed with the statistics that legislator Lightfoot brought out that an anticipated workload would be a minimum of 2,000 hours in a year. I'm sure that our county attorney puts in much more time than that. If you've ever hired a lawyer, you know that they charge by the hour. Figuring that salary divided by that 2,000, you come up with $79 an hour, which I think that's impressive to me to ensure that I will vote for this.
Okay, Mr. on. Yes, Tony, go ahead, Mr. Rocco.
Thank you, Mr. Chairman. I'll be supporting this resolution. I've been here long enough to have worked with Attorney Button in many different capacities in the county, but most lengthy as our county attorney. And, I think that we all realize that our geographics here in the North Country, unfortunately, lead us sometimes to have some of our best people either move away from here, or it's very difficult for us to get folks to come in and take some of these high-level positions. And, Mr. Burke brought out a great point in saying that, so many of our department heads work so well. I wish that we were lucrative enough to incentivize all of our positions, but in the public sector, the private sector, attorneys, people in the high level medical facilities generally make more than other folks. And Mr. Button is well versed in every aspect of county government as there is. And I mean, he's a young man. We're fortunate to have him. I think that this increase in pay is well deserved, just solely as the county attorney, not to mention his the duties that have been placed upon him in Department of Social Services. So I fully support this and would like to be added as a co-sponsor, please.
So noted. Mr. Perkins.
Thank you, Mr. Chairman. I think one other thing that we haven't spoke about is within this salary with these new duties, there's a 66% reimbursement rate from the state. I think that's important to know. And I'd also like to be added as a co-sponsor.
Okay, so noted. Okay. Any other discussion? No discussion. We'll vote on the amended resolution. All in favor?
Aye.
Opposed? Mr. Burke and Ms. Haggard. And I don't see anyone on the screen. 2 votes against. Motion carries. The resolution carries.
Can I just say that Ruth wanted to say she had no issues with the amendment, is what she was trying to say.
Didn't sound like it.
Did she say something about?
All
the
right,
next
Mr.
resolution
Reagan.
being wrong?
Mr. Chairman, I'd like to move a resolution authorizing the filling of vacancies.
Seconded by Mr. Smithers. Any discussion? No discussion? All in favor?
Aye.
Opposed? Carried. Mr. Lightfoot.
Mr. Chairman, I offer a resolution authorizing an intergovernmental transfer for an upper payment limit and modifying the 2021 budget for community services and move for its adoption.
Seconded by Mr. Burke. Any discussion? All in favor?
Aye.
Opposed? Carried. Mr. Lightfoot.
Mr. Chairman, I offer a resolution authorizing the chair to sign a contract with Scientific Consulting of Western New York Incorporated for pathology services for the coroner program and move for its adoption.
Seconded by Mr. Smithers, Mr. Denisha. Any discussion? No discussion. All in favor?
Aye.
Opposed? Carried. Mr. Lightfoot.
Mr. Chairman, I offer a resolution recognizing the challenges in child protective services and preventive services and the efforts underway to implement systemic change in children's services in the Department of Social Services. Move for its adoption.
Seconded by Mr. Smithers. Any discussion? Mr. Lightfoot.
Mr. Chairman, just to take a moment to try and encapsulate what is in this rather lengthy resolution. It is an attempt to bring together many, if not all of, and I don't think that we've gotten all of them, but we've got many of them, the issues that are facing us and confronting us in the Department of Social Services. I think for too long now, we have sat on our hands and have not, responded to some of the, or any of the criticism that's been leveled at St. Lawrence County, and I think it's time that we have. People have short memories, and if they stop and think, over a year ago, we were looking at this problem, trying to decide what to do, and looking for information from social services that was not forthcoming. We find out later that a report had been provided to DSS by the Office of Children and Family Services that we never saw. Had that item, that document, that report been shared, we would have seen with the transparency that it provided some of the issues that we were looking at, and perhaps may have taken a different tack as far as how we were going to address them. We were actually operating somewhat in the blind, I would say, by not having that information. This just puts some emphasis on what this board and what the administration of St. Lawrence County has done to try and address each and every one of the issues in social services, not today, not as a knee-jerk reaction, but as a plan adopted, as I said, fully a year ago, on how we were going to progress. Certainly, additional information has been forthcoming since this started, and we still have a lot of work to do. But I think what this does, and what it will do is hopefully give the press something to look at and get the word out that St. Lawrence County has not sat on its hands. It has done something. It continues to do something. And we are looking through another resolution upcoming to providing some additional service to try and serve, the people that have had, I guess for lack of a better word, bad issues with our social services. So the whole idea in a nutshell is this is what we've done, this is what we've been doing, this is what we're going to continue to do.
Mr. Burke.
Over the weekend, I decided to take some time and go back and re-listen to the presentation that DSS provided us. I can't exactly give you the date, but Bill, you were there, Rick was there, Joe was there, Nicole was there. And to re-listen to what was told to us at the time, it was about an hour and a half presentation. And as I look at this resolution, I'm thinking, we are presenting what the county has done, but we're not giving a total picture of what the county hasn't done. The petition, the plea back then was to give us the resources that we need. And in that presentation, there was a reference made, and again, this was, I think it was the middle of February, but it was no later than March 5th, because March 5th, Ruth sent out the YouTube for all of us to view that, to view the presentation. So, but in that presentation, there was a reference, and I think it was maybe by Heather Rand, that she referred to the the Office of Children and Family Services audit that is the hot topic right now. So, I decided I was going to call Cindy because I wanted to, the article in the paper was pretty damning. It certainly would give you the appearance that she sat on information that was relevant to all of us. And the reality of it is that didn't happen. That there's an email that verifies that didn't happen. That the summary of that audit was indeed turned over to the county by Cindy. And, and I just want to recap in that presentation by DSS. We heard from all of their leadership. And here's what they said at the time. 49% of our investigations are overdue. 70% of the safety assessments were complete, placing our county 49th in the state. So I'm assuming that 30% weren't completed on time. 63% of the caseworkers had caseloads of over 15, which was the maximum recommended by the state at the time. Well, children in care decreased statewide from 2017 to 2020. We went from 162 to 327. While the human costs may be difficult to assess, the financial cost to county taxpayers was significant. Of the caseworkers employed at that time, 15 had less than 5 years of experience. Cases were reported to be very demanding, very complex. And I think if one of the things that we've all heard is how long it takes to get a new employee up to speed. We all know that we have a high turnover rate, it's about 12%. And the other part of that is so when you hire new people, it takes probably a year to get them to assume a nominal caseload. And so even if we gave them today the number of caseworkers that we needed, it would not bring them up to speed. If we divided the total number of cases by 15, we'd come up with about 43. Okay, we have 28 to 30. I tried calling social services today to get that confirmed. I'm pretty sure it's right in the 28 to 30 range, but I wasn't able to touch base with anybody. So we're down a significant number. And if you remember that graph that was shown to us, the numbers, the number of new employees is pretty significant. That it showed us the number of people where they were in their orientation. So and again, I'm going to bring it back to this resolution, if I can, and that I think we owe it to the public. Especially after what we heard tonight, I think we owe it to the public to be as candid as we possibly can, not just about what we've tried to do. And I think the outline of this, we did do things. Some things were productive, but we have to give DSS the resources they need before we can hold them accountable for the job we expect them to do. We put them in a terrible position, and we put the public in a terrible position. We heard tonight and I'd love to hear more about some of the stories that were told to us tonight. But so we put the public in a terrible position, we put our employees in a terrible position. As far as I'm concerned, let's give them the resources that they need. Let's make sure they have caseloads of no more than 15. We've had 7 months since this presentation. And we have gone from 63% to 76%. We have 76, we've gone from 63% of our caseworkers having more than 15 to now 76%. That was in the graph that was just handed out to us, showing the end of August report. So we're not doing well. We've done some good things, and I don't dispute what's in here, but we have to do better than we have been doing. We have to give them the resources that they need. We would need 43, I think I said that. Not only did that presentation, that hour-and-a-half presentation, provide a thorough assessment of DSS over 8 years, but it also provided a detailed plan for remediation. How do we get out of this? How do we fix it? And again, I don't think that was received warmly among the legislative group. And then the presentation in the newspaper, and again, I don't mean to, it's certainly not my intent to focus on any one person, but I have to come to the defense of our ex-commissioner. And I'll tell you, the one thing, I mean, there are a number of very quality things about this person, but she was of highest integrity. As far as I'm concerned, she would not lie, she would not deceive, she would tell you as she saw it, whether you agreed with her or not. She would tell you exactly what she felt. And then, then I look at that article and I'm thinking, geez, how could we say that this report, this OSC report, was slid away in a desk drawer and essentially forgotten? And again, I saw the memo, I saw the email that was sent that said the summary of the audit is attached. The 4 pages, the last 4 pages of that audit that everybody's referring to, the Office of Children and Family Services audit, was given to the county. And again, my feeling is that first and foremost, let's own up to what we haven't done. We haven't given them the resources they need. We haven't, and we put them in a heck of a position. We have a whole group of people coming in here tonight telling us that we're falling short, and we need to listen to that. We need to give the resources required to get the job done, and we failed to do that. And the people that worked there before, the ex-employees, I mean, when I think of the countless hours that both Cindy and Dave Haggard put in, and whether it was like, it was countless hours. He was the sole attorney for several months. He was one of 2 or 3 attorneys for many months. We now have a complement of almost 6 attorneys dedicated to DSS. Over the course of this period of time, we didn't average 3. So again, as far as I can say that the challenge that we have to face, and that we have to tell the public is, look, we're going to give the resources that they need. And then when we do that, you know, you hold us accountable for giving the resources, we'll hold our staff accountable for delivering. And that's where I think we need to be. And again, forgive me for rambling on. It wasn't my intent, and I'm not trying to cast any negative doubt on anybody, but I do think that for a sense of fairness, we have to look to what we did and what we didn't do. And we didn't listen. We listened, we didn't react. I mean, forgive me, Rick, for your comment at the end of that session. I just listened to it again. So it's like you said, it's like pouring a glass of water on fire to try to put it out. And Bill, I think you said that it was eye-opening and enlightening. So let's if you forgot what they said, let's take a look at it. The Office of Children and Family Services audit was referenced in that presentation. I don't think that there was any attempt to keep that from anybody. Whether it got lost in the shovel, I'm not about to point fingers, but I know for certain, because I've seen the emails, that it was delivered. Thank you.
Senator.
The report was on February 11th. That gives everyone some time frame about how long we've known what the problems were. February 11th.
Is that it? What you wanted to say?
That's it.
Okay. I'd just like to remind you that, yeah, I was at that meeting, and yes, I did hear the concerns that were raised and the numbers that they wanted to increase that department by. But I do realize also that in the last year, I think we have done an awful lot as a result of some of the information we heard in that meeting. And that is, I think we've approved over 20 positions since then for the Department of Social Services. And I think we've approved 20, I think 17 have been filled. I think those numbers are correct. But we have not just avoided everything that we've learned at that meeting. And this resolution that we're talking about right now, I wish maybe we should just read it. It's full of information of what we've done to fix this problem. 2 pages worth of it. In fact, I hope the press really spends a lot of time printing what is in this resolution, because it really shows that St. Lawrence County has not been just sitting around not doing anything since we started hearing reports from the state of New York. I think we've done an awful lot. And so with that said, any other discussion? Mr. Blackwood?
Yeah. The last thing I want to do is get in the back and forth with Legislator Burt or Legislator Haggard. But I want to point out one thing, is that one of our legislators made an inquiry of one of the supervisors, one of the major supervisors at DSS since Cynthia left the county's employ. And that legislator wanted to know why the report was not released. And in an email, that senior supervisor, quote, she says, "The guidance provided from the legal general counsel," that would be Mr. Haggard, "to the commissioner, Cynthia, was not to release the full report at that time due to potential confidentiality concerns." Now, I'm not sure what meeting we're talking about. Was it the meeting where I think Heather Rand gave a presentation and then Mr. Haggard made a presentation? You know what I remember about that? A lecture about shall and may, which really didn't make me very happy to hear that. The other thing that I remember from Mr. Haggard at that time was we keep going the way we're going, we'll have over 400 kids in custody and care at the end, in the following year. I don't know that during that February report, if that report had even been received by them. I have no idea. I have seen the report now. I would ask Legislator Haggard when she saw the report and who provided it to her. Because I haven't talked to any legislator or the county administrator or the board chairman about, have you seen any of the report at all? And I got negative answers from everybody, John, everybody. So I gotta say, there's a lot more going on here than we are all aware of. The report was there. One of the top people in DSS says it was there, and that the order came out from the general counsel not to release it because of confidentiality concerns. That's all I have to say.
Senator, go ahead, Mr. Akins.
Okay.
So I remember, it was February, because Mr. Sheridan, you called me, I was in Florida visiting a friend and my sister about this meeting that was going to take place. So that was in the middle of February, I think February 11th, I can't remember the exact time period. But I want to point out in the resolution that the board took action in March. And we have hired over 20 people. We actually just approved 2 people tonight. There's a recurring thing that, as you read in the resolution, I can't find it here right now, about that any of these up to 5 vacancies that occur, that the social services can move ahead and fill in those positions without coming back and asking the board for approval of those vacancies. And yeah, there is turnover. We heard the stories tonight from the parents. We've heard from the CPS workers, you know, how difficult this job is. I can remember when we interviewed people for the probation directors, and you looked on their resumes and they had, they worked for Child Protective Services for 6 months, or they worked for a year or a year and a half. And I always asked them, it's a short time period, and they had problems. They had nightmares. They couldn't sleep at night because of the things that they had experienced, what they were exposed to in some of these homes. It is a very difficult job. And I think, you know, the board, through that presentation and other things that we've become aware, and certainly these parents tonight and in the previous meetings have let me know. We've got some problems over there, but I think this board is intent on solving this issue and getting to the bottom of it. And definitely by hiring 20 people, it doesn't solve the problem, but it's reducing that caseload so that attention can be given quicker and more effectively. And I think the training, and that's the training of the supervisors themselves also. You know, we need to continue to improve and react quicker, as quickly as we can within the law.
Ms. Hager?
Thank you, Mr. Chair. With all due respect to my colleague, Mr. Lightfoot, I don't think I stated that I saw the report. What I said was the report was referenced in the February 11th presentation. I just want to clarify that. Secondly, we have provided some of the people. I don't think we have provided everything they've asked for in DSS. And I want to commend the people of DSS at the same time hearing what is said to us every time we meet. I do understand. Parents, and I'm a parent myself, we all do. But just to be clear, I did not say I saw the report. I said that it was referenced in the meeting. Which I did see.
Mr. Lightfoot?
If I may, and if we may, continue this, because it's going to get a little personal, if we could continue this in executive session.
Okay, great. That's all right.
That's fine.
Mr. Fay?
Thank you.
Okay, I think we all know we have to move forward, so let's move forward. Let's call the question.
Second question, call, all in favor of calling?
Aye.
Call the question? Anyone opposed? Call the question. Good. let's go on the amendment as amended, the resolution as amended. All in favor of the resolution?
Excuse
as
me,
amended?
what was the amendment?
There's no amendment.
There's no, that's all right, so it's just,
Did I misunderstand?
or that, we've already covered that.
There's no
Okay.
amendment. Just move the
Just move to the resolution.
Yes.
Okay. All in favor of the resolution?
Aye.
Anyone opposed? Mr. Burke? And Ms. Hager? Carried. Mr. Lightfoot?
Mr. Chairman, I offer a resolution authorizing the chair to sign a contract with the Bonadeo Group to provide professional services to a comprehensive review of children's services in the Department of Social Services and modifying the 2021 budget for the Department of Social Services and move for its adoption.
Second by Mr. Denisha. Any discussion? Mr. Smith?
I think that, to move forward, I think this is a very positive move. And I'd like to commend our county administrator for putting this forward. I think it's a great idea. As part of this, talks about a report in 6 months. And I think we might want to have more frequent reports than that.
Mr. Lightfoot?
Mr. Chairman, I would like to amend the fourth whereas in this resolution. And in doing so, I would completely delete, as it is right now in the resolution, and replace it with the following. Whereas the professional services of the Bonadino Group has been requested and will include will include interviews of staff, complainants, case documentation and review of policy and procedures to include observations and recommendations which will be presented to the Board of Legislators on a monthly basis. Additionally, should information be developed, the seriousness of which becomes readily apparent, it will be immediately reported to the County Administrator of St. Lawrence County. I would move that that resolution be adopted in place of the fourth whereas as it currently stands.
Moved and seconded by Mr. Burke and Mr. Denisha. Mr. Lightfoot?
The reason for that, obviously, is that 6-month review that they were offering originally. I've spoken to the county administrator. She has spoken to the Bonadeo Group. They are on board with providing this board a monthly review. Obviously need to be set up, but they have no reservations about doing so, for which I give them credit for. And I don't know if the topic of the second part of that, where if they develop something that needs immediate attention, we need to know about it. We don't need to wait for what could be 30 days to find out about some of these things. So that was why that was added. I can't imagine that they would not be on board with that either. But if that happens, I'm sure we can straighten it out.
Mr. Andrews?
Well, I support the amendment by Mr. Lightfoot and seconded by Mr. Denisha. I was wondering because there were some comments in public, or some of the public interaction during the public comment part was referring to this as basically a payroll company. And I wonder if Mr. Soper, our county assistant administrator, or our county administrator, Ruth Doyle, if we can hear her, she could talk about the Bonadeo Group. We can try. Ruth, if that's all right with you, Mr. Chairman.
Yes, that's great. Fine.
Can you hear me any better?
Yeah.
So the Bonadeo Group has been trained by and works with OCFS to conduct these very type of reviews. They've conducted them in over 11 counties specific to quality control. They also do a number of other types of audits in units like chronic care, Medicaid. They do a number of audits. We have spoken about any actionable items associated with their review. I know there was also a concern raised about actionable based upon any misconduct that will be provided to us immediately. And I've spoken with the district attorney already as well. So I think we do have the ability. They are trained in this. They can also look at the Title IV funding, which was part of the foster care concerns that were raised. But they are well trained in this area and they know what to look for, and certainly will entertain any of your questions as they report out to us each time. They also will be able to, if the board approves this resolution, they'll also be able to be on site by next week.
Mr. Akers.
This is just a follow-up from the amendment that Mr. Lightfoot has proposed. As you engage them in conversation, what type of reports, they seem to be on board with the 1 month reporting?
They were intending to provide reports each 2 months. However, they're fine to provide them every 30 days and they can do that verbally. And certainly they indicated once they're on site, they won't wait for 30 days to make a report to us. If they observe something that should be taking place or something that shouldn't be taking place, they'll tell us immediately.
One more. Are they indeed a payroll company, as was asserted tonight by one of the commentators?
They have a variety of services. I'm not sure if payroll is one of them, but they do governance, general governance in a variety of ways. I can send you all of the areas that they work in.
Okay. Thank you.
Mr. Reagan.
It's my understanding that when you were in your work with the New York State Association of Counties, that you spoke to quite a few other counties and NISAC as well, and that this firm was highly recommended by other counties in the state for this kind of work.
That's true. NISAC has a working relationship with them. Also, in one of my conversations with another county, they brought them in to do a 2-unit review and ended up having them go through each unit in the department. So certainly some options based upon the board's first approval of their work, but also review of the outcome.
Mr. Smithers.
Just like to point out, I hadn't noticed this before, but there is on the Google Drive quite a bit of information about this group, in case you haven't seen it. I haven't until just now.
Surprise, surprise.
Their proposal's been added to Google Drive for you to review.
Ms. Haggard.
Thank you. I think Mrs. Doyle did a great job in being very careful to find an organization that was both familiar with the state and that didn't have any connection to anyone, as far as I know, in social services. And I did point out, and not that I would suspect anything nefarious, but that Mr. Button wouldn't be involved in the direction of these people, as he is now a player in DSS. It would be a conflict. Thank you.
Any other discussion?
Ms.
Kern.
Yes, I'm very glad to see an outside agency coming in has no connection to anybody, because I've talked to several employees over there at DSS, and they feel that it would be helpful to them to have an outside agency look at them, because they're looking for clarification of the problems that there are, and then they would like to move forward to repairing things, because ultimately it is important that they can take care of the children, and they're concerned about the public perception and how it is affecting them being able to investigate things. So I'm glad that we have somebody outside going through it. I believe there have been a number of conflicts over there in the past, and I look forward to what these people have to say.
Any other discussion? Are we ready to vote on the amendment? All in favor of the amendment proposed by Legislator Lightfoot?
Aye.
Opposed? Amendment carries. Now on the resolution as amended. All in favor of the resolution as amended?
Aye.
Anyone opposed?
Mr. Chair, I
No,
believe it's a roll call.
Yeah.
Okay, we got roll call.
Yes.
Yep.
Thank you.
Akers,
Yes.
Fay,
Yes.
Haggard,
Yes.
Piacco,
Yes.
Burke,
Yes.
Arquette,
Yes.
Terminelli,
Yes.
Curran,
Yes.
Reagan,
Yes.
Forsythe,
Yes.
Lightfoot,
Yes.
Sheridan,
Yes.
Smithers,
Yes.
Denisha,
Yes.
Perkins,
Yes.
15 yes.
Carried. Okay, on to old and new business. Is there any old or new business? I don't see any old or new business. Oh, yes, we do. Larry Denisha, go ahead. Larry.
I'm not sure if this is an appropriate place for it, but I don't see anything else on the agenda. Two things, if I may. During the public participation, I think it's wonderful that we had, I think about 2 dozen folks here. But one of the things that troubled me is it was rude behavior.
Yeah.
And, I think, while we may not agree with one another's opinions or what, it was just generally rude behavior. And I would implore the chair, not to accept that in the future.
I leaned up forward and I think you could see that I was leaning up thinking like, who is that over there that's making the noise? And I saw that he stopped a little bit more, but yeah.
But it was just generally, so that would be my.
And I did heed the warning from Miss Haggard in the back row there that on the comments right from the start. So I tried to intervene as much as I could without being.
But there was, there were folks who were speaking, particularly the lady from CPS. And there were conversations going on, just disparaging, it wasn't proper. Secondly, if I may, when I was seated here in my desk, and I had my, but I wasn't moving around, I had my mask off. But then when we started, a number of people started piling in, I did put my mask on because I'm uncomfortable being around a lot of folks that, and one of the things that struck me as odd, our desks have been moved so that we could accommodate the 6-foot distancing. And there were at least 2 dozen folks in attendance. Most of them are noticed without any masks. Definitely not distanced. And it made me feel uncomfortable. I suspect it made some other people feel uncomfortable. Our public health department openly recommends and strongly encourages, and this is the words from the daily COVID report, mask wearing. And again, I'm not a mask fanatic, but if you can't social distance, we should be cognizant of other folks. So I would suggest that for the board meetings, that we have public attendance, that they be held in a space where social distancing can be accomplished.
Ms. Haggard?
As usual, I always like what Mr. Denisha says.
I can't hear you.
As I said, Mr. Denisha always makes great points, and I like what he said, and I would like to thank you for addressing my concern about the topics. Not in any way trying to limit people's First Amendment right. But it was really difficult since everyone in attendance paid close attention when the speakers were speaking. But when the women from DSS got up, there were a lot of rude comments. I'm very close and I could hear them. It's very upsetting. Yeah. I don't know how to.
We could start having the sheriff pull them out, I guess.
Well, that's up to you, Mr. Chairman. I'm not going to suggest that, but it's a matter of decorum, I think, more than anything. It's just plain good manners.
Mrs. Perkins.
I agree with Mr. Denisha. There was some rude comments there in the two ladies from DSS. They had as much right as everybody else to be here and say what they said, which I commend them for. But there were also some of the speakers that were addressing them, talking to them personally. They need to address the board.
Correct.
The people in attendance. That was not right to put them in that place. So if we can pay attention to that from now on, I think that would be good so that they're not intimidated to not come back.
Bill Forsythe has his hand up. Forsythe?
Yes, Dave Forsythe.
Two things, on that point in particular, any member of the board at any time can intervene, I believe. And encourage the chair to do that. What I wanted to talk about was the northern border. It's become an issue. I know there's businesses in Jim and my district that are struggling, severely struggling. And we've been pretty silent, I think, and I think it's time we turn up the dial. I don't know who we have to get a hold of. When you watch the news, they show the southern border, they show the southern border, they show the southern border, and it's an influx. And the northern border, where they can control it with people vaccinated back and forth, I don't understand why we're not open. So I think we really have to turn up the volume on this because this is getting crazy. Just my thought.
Mr. Arkwood.
Thank you, Mr. Chairman. And I agree with Dave on that one, certainly in the Messina area as well. We're very anxious to make that move. I personally think one of the problems is the Canadian side, obviously. But I think that our voices need to be heard in that regard where it comes to economics and simply being able to get across there. But secondly, if I may, Mr. Chairman, on a much, much different note, I just wanted to report to the board that the reconciliation of the trail passes have come in, thanks to Dylan, and appreciate all of Dylan's efforts on this initiative. We sold a total of 1,326 passes for a grand total of $70,947. 5,450 of those dollars went to ATV clubs with 65,497 to the trail fund. So I would commend everybody involved, and it's a great initiative, and we'll build on it. And again, thanks to everybody and Deb and the entire team and making this happen on the first year. Thank you.
Anyone else? Yes, Stephanie.
For one, I think Mr. Denisha makes a good point. There were rude comments made today. Show the integrity of Mr. Room was mostly the one I know Bill personally. He needs to conduct himself in a better manner. I'm not interested in having anyone yanked out of there. This is a highly emotional issue for many of them. Not Mr. Room. Mr. Room does not have any children that have been impacted by this. but they are all citizens of St. Lawrence County. Certainly, like Mr. Forsyth said, Mrs. Haggard or myself, I tried to catch Mr. Rube's attention. Like the goal here, we had a little class, and he wasn't paying attention. So I think a couple comments from you to him privately, in person, before the meeting starts, would be appropriate. And then if it does continue, then we could have to go to step 2. But many of these people have been hurt in some way, whether it's their children, themselves. I mean, their emotional relationships have definitely been impacted by this, and they felt they've been wrong. So I think a little bit of emotion is, we can stand a little tolerance for that. But at the same time, if we have speakers in opposition, certainly the caseworkers are here. We're under tremendous stress, and to present a different side, and that should be respected. And the group here that are affected in the other direction should be cognizant of that.
Mr. Reagan.
I just want to thank and echo Dave's comments about the problems we're facing because of the border closure. The businesses in Ogdensburg, and I'm sure it's the same in Messina, are suffering. And business people have been limping along for a year and a half, waiting for the Canadian and the US federal governments to fulfill their promises to open the border. And I will be drafting a proposed resolution to be brought up at the next meeting, asking formally and asking other border communities to join us in calling for the reopening of what has traditionally been the longest, friendliest border in the world, because our people are suffering.
Any more old or new business?
No.
Yes.
Just to echo Mr. Reagan's, Joanne Fabrics, we all got an email that Joanne Fabrics is closing. Joanne Fabrics has probably majority of their customers are Canadian. And so now for the quilters, the sewers, they'll have to go to Plattsburgh or Watertown, the Joanne Fabrics there. But I think that is a direct result. I would imagine that the UPS store that does a lot of Canadian business has been hugely impacted.
Mm-hmm.
Canada has about the same vaccination rate. They may have actually a little bit higher vaccination rate than what we have here in the North Country. Certainly, we would welcome them back if possible.
Mr. Reagan.
Thank you, Mr. Akers. And I gotten the address and name of the president of Joanne Fabrics at corporate headquarters, and I'll be drafting a resolution urging him to reconsider his decision to close that store, because for a lot of families, they depend on that store. It provides some recreation, hobbies that benefit them and their families. And especially, as we saw during the past year and a half, to lose that, it comes as a real blow, not only to the families, but to those who are served by that store and UPS and other stores. Thank you.
Anything else? Okay. Next thing we come into is chair's appointments. The broadband ad hoc committee will consist of Margaret Hager and Nicole Criminelli and Suzanne Fiacco. Mark will be the chairman, and they will be assisting and being in close contact with our IT and our planning department to work this broadband issue out. And it looks like executive session will be in order next. Mr. Lightfoot.
It's not on the agenda, so there's no executive session. I don't believe.
I thought we made that motion right at the beginning.
We amended the agenda to include it.
At the beginning, we changed the executive into that category.
It too.
We should have voted that down.
Yeah.
We should have voted that down.
Yeah.
We slid that in there.
Forgive me, Mr. Chairman.
You were preparing for all the amendments we were gonna do. Anyway, so that's executive session now. If someone wants to make a.
So I will move to go into
motion.
executive session.
Second by who?
We need.
Here's my little post for the infrastructure bill.
We need
I threw it in there
just-
for you.
just socialist gibberish.
Yes, I know, I love it.
Just.
I know.
Oh, yeah.
Yeah, well.
We're gonna go into executive session, somebody makes a motion.
If Ruth or Dylan could list what we're going into executive session for.
Oh, yes,
I
yes,
can.
Ruth. Sorry about
Yes.
that. Ruth, we have need for executive session.
That's okay.
And for what
We do
reason?
for litigation and negotiations. And if you can hear me, for personnel, for the medical, financial, credit, or employment history of a particular person or corporation or matters leading to the appointment, employment, promotion, demotion, discipline, suspension, dismissal, removal of a particular person or corporation.
With that-
Ruth, do you have Dave up on the telephone pole? Is he getting reception for you? Huh?
I probably should.
Executive session, second by Ms.
Green egg
Burns.